Ìtura mi dé ọ̀tún. Okay. I don't know, maybe I call it well. Ẹ káàbọ̀, ẹ káàbọ̀, ẹ káàbọ̀. Lórí Facebook, thank you. Lórí YouTube, thank you. Lórí TikTok, welcome, welcome, welcome. Ẹ káàbọ̀, ẹ káàbọ̀, ẹ káàbọ̀, ẹ káàbọ̀. Àwọn wo ni ò tún ní jẹ́ kí n gbádùn o, ẹ jọ̀ọ́ o. A ṣẹ̀ fẹ́ bẹ̀rẹ̀ ètò ni o. Ẹ wò ó. Láti àti ìgbà wo ni tí mo ti wà nílé tí mo ti ń dáhùn question. Ẹ jẹ́ ká ṣe health là ń sọ̀rọ̀ lé lórí lónìí. So a ti ṣe ẹ fún mi ní ìṣẹ́jú kan, ẹ dákun. Ẹ ló bò ní Láìdé.
Ẹ ló má
O
mo ní àbúrò mẹ́rin mo bímọ láàárọ̀ yìí.
Ọlọ́run ṣeun o. Ọkùnrin àbóbìnrin.
Ọkùnrin.
Tọ̀ ó dà á mọ̀ pé wọ́n bá ti parí life.
No problem.
Okay. Ẹ má bínú o, ẹ má bínú. Thank you for the gift. Thank you. I'm back. I was out yesterday. Àná was first day tí mo jáde síta, and mo wá ròyìn mother-in-law mi sí everybody. Mo wá sọ̀rọ̀ nípa mother-in-law. I want people to know the type of mother-in-law I want to be. So mo jáde lánàá. Alhamdulillah Rabbil Alamin. Thank you. Ṣùgbọ́n ọ̀rọ̀ tá a máa sọ lónìí, thank you ìjọba, nípa ògógó là á sọ̀rọ̀ lé lórí lónìí, but tí kò sí point nínú wípé kí n fi kíní rẹ̀ sí. Ṣùgbọ́n kí ni nǹkan tí a máa sọ lónìí? A sọ̀rọ̀ nípa cancer generally. Kò kí ń ṣe prostate cancer, heart ò kí ń sábà ní cancer, nítorí tó jẹ́ pé cells kíní kò wá rapid níbi heart. Ọlọ́run ọba tóbi. So cancer generally, either cancer of the brain, cancer of the mouth, cancer of the nose, cancer of the bone, cancer of the lungs, cancer of the cervix, of the vagina, of the penis, of the tongue, of the lungs, of the throat. Gbogbo rẹ̀ ò lá sọ̀rọ̀ lé lórí. Àní máa sọ wípé bóyá ká máa pè é níkọ̀ọ̀kan. Rárá, ìyẹn kọ́. A sọ̀rọ̀ generally lórí cancer. Kí gbogbo wa, kò sẹ́ni tí kò lè mú, kò sẹ́ni tí cancer ò lè mú. Then máa jẹ́ ká mọ àwọn condition kọ̀ọ̀kan tí a fi máa misdiagnose cancer. Máa jẹ́ ká mọ̀. Àmọ́ kó tó di pé àwọn èèyàn dúró, nítorí tó jẹ́ pé èèyàn 37-40 olóṣì ń wò mí níbí, ẹyọ̀kan ní YouTube, ẹyọ̀kan èèyàn 4 péré ní social media. Ẹ jẹ́ ká digress. Fún ẹ̀yin tí ẹ mọ̀ wípé mo ti dé o. Mo really appreciate effort everybody. Títí throughout month yìí, ó ní màá fi máa kí àwọn èèyàn, tí màá fi máa appreciate àwọn tó fún wa lówó, àwọn tó visit wa, messages, gbogbo ẹ̀ màá máa appreciate. Màá dẹ̀ jẹ́ ká sọ, ẹ jẹ́ ká jẹ́ ẹni ire, ẹ jẹ́ ká jẹ́ èèyàn tó dáa. A lè jẹ́ ẹni ire all rounder, ṣùgbọ́n ní àdúgbò ibi tá à ń gbé, ẹ jẹ́ kí dáadáa wa kó pọ̀ ju àìdáa wa lọ. Ẹ má jẹ́ kí ojú ayé kó pọ̀ ní ọ̀rọ̀ wa. Mo fẹ́ fira mi cite example. Wa alaikum salam. Mo fẹ́ fira mi cite example. Kí ni example tí mo fẹ́ cite? ẹ má hùwà burúkú o, ẹ má hùwà burúkú. Sẹ́rí Ọlọ́run ọba tá à ń sìn ó máa ń fìyàn hàn ní ọjọ́ tẹ́ ẹ bá fọkàn sí. Ọba tó máa ń fọ́ yẹ̀yẹ́ bóyàn ni tí ẹ lè mọ̀. So téèyàn bá jẹ́ tẹ́ bá jẹ́ ẹni tó jẹ́ pé ọ lè kẹ́gàn jù, ọjọ́ téèyàn ò fọkàn sí Ọlọ́run ó fẹ́ yẹ̀yẹ́ bóyàn. Ìwà tá a bá máa hù tí yóò bá tayé ọmọ wa jẹ́, ọmọ wa, ara wa gangan, ẹni tó súnmọ́ wa, Ọlọ́run ò ní jẹ́ ká hù. Ní ọjọ́ tí wọ́n pè mí, òní ló pé 22 days bóyá 21 days tí Mother-in-law mi kú. Dédé àsìkò yìí náà ni mo bẹ̀rẹ̀ life ní ọjọ́ yẹn. Ìgbà tó di exactly 3:15 wọ́n pè mí from Nigeria wípé Mother-in-law mi kú. Ǹjẹ́ mọ̀ pé mo sáré wá, mo wá sọ fún yín wípé mo ń lọ wípé wọ́n sọ pé Mother-in-law mi kú. Ẹ jẹ́ ká ṣe dáadáa. Ọlọ́run ò ní dá yẹ̀yẹ́ wa kalẹ̀. Mo rántí mo pa TikTok, ṣùgbọ́n mi ò pa Facebook, mi ò dẹ̀ pa YouTube. Mo dẹ̀ ń ṣe nǹkan lọ níbí yìí. Immediately tí wọ́n ti sọ, mo pa fóònù yìí, mo fi ń pè. Immediately mo pe ọkọ mi. Ìpè ṣé wọ́n pè yín láti ilé? Wọ́n ní wọ́n ti pe àwọn, pàtàkì ni wọ́n ti pe àwọn, àìnódì mi ni wọ́n ti pè mí. Mo bẹ̀rẹ̀ sí ní pe àwọn àbúrò mi, àwọn tí mo sá mọ̀, how they can make it to Kwara, and I was also crying. Tó bá jẹ́ wípé immediately tó ṣẹlẹ̀ kí n wá pa eléyìí, kí n wá máa ṣe yẹ̀yẹ́ in which tí àwọn ọmọ èèyàn máa ń ṣe social media ló máa gbé mi síta láì jẹ́ pé ẹnìkan kan ṣòfófó mi. Ẹ má jẹ́ ká ṣàbòsí. Be yourself. Kò sí ẹ̀dá tó dáa tán. Èmi tí mo ń sọ̀rọ̀ èmi ì dáa tán. Ẹ̀yin tẹ́ ń gbọ́ mi ẹ̀ dáa tán. Ìyá ọkọ yín ò dáa tán. Àwa ìyàwó ọmọ ò dáa tán. Àwa ìyá ọkọ lónìí à dáa tán. Àwa ọkọ wọn ò dáa tán. Àwa ìyàwó à dáa tán. Gbogbo ẹ̀dá tó wà lórí èpẹ̀ kò sẹ́ni tó dáa tán. Ká gbà pé immediately tí ọ̀rọ̀ yẹn ṣẹlẹ̀ kí n wá bẹ̀rẹ̀ sí ní máa make guess. Sọ̀rọ̀ pé òun ò ní ṣe mọ́ ni, sọ̀rọ̀ pé òun kò sí èèyàn méjì tí yóò wà tí ẹ̀ ní ṣẹra yín. Ìyá àtọmọ máa ṣẹra wọn, ọkọ àtìyàwó máa ṣẹra wọn, aládùúgbò máa ṣẹra wọn. So gbogbo nǹkan tá a bá wà, be conscious of what you are doing, especially ní ayé òde òní tí a wà ní orí social media yìí. Mo dúpẹ́ lọ́dọ̀ Ọlọ́run tó jẹ́ pé I was myself. Bó ṣe pain mi, bẹ́ẹ̀ náà ni mo ṣe ń sọkún without knowing wípé Facebook and YouTube both were recording me. Ká gbà pé immediately tí mo gbé fóònù kalẹ̀ kí n máa ṣe yẹ̀yẹ́ bí wọ́n ṣe gbé mi síta náà nìyẹn. Téèyàn ó di ẹni yẹ̀yẹ́ tá yóò fi tán. Be yourself. Be yourself. Be yourself. Gbogbo ìgbà kígbà tá a bá ń wò tá a ń ṣe nǹkan, ẹ jẹ́ ká máa rántí wípé tọba ayé ò bá rí wa, tọ̀run wò wá. Ọba ayé ti pọ̀ ní ìta yìí nísìnyìí o. Òun ni social media yìí. You can even be doing things and people passing by will be recording you and you won't even know. You won't even know. Later, ìgbà tí mo wá realize wípé mi ì máa pa Facebook, mo sáré dìde. Mo sọ wípé, oh, I'm sorry, people on Facebook, I haven't turned off my Facebook. My mother-in-law just passed away. All those things, blah, blah. Kí n tó wò ó, kí n tó rí mẹ́sẹ̀gì ti pọ̀ ní orí Facebook àti YouTube. Ọlọ́run ó foríjì wọ́n, Ọlọ́run ó foríjì wọ́n, Ọlọ́run ó foríjì wọ́n. Ká wá gbà pé èmi délé tí mo gbọ́, kí n wá sọ pé kí n bẹ̀rẹ̀ sí ní máa ṣe yẹ̀yẹ́. Àsìkò tí mo gbé ojú sókè yẹn náà, èpè yóò ti pọ̀ lórí social media. Dẹ́kẹ́ tó mọ̀ nǹkan tó ń ṣẹlẹ̀, ìyá àlùbáríkà tẹ́ ń pè mí, tẹ́mi náà rí yín wípé good fans, ọ̀pọ̀lọpọ̀ yóò tiẹ̀ ti unfollow mi. Wọ́n dẹ̀ ti pín ká, gbogbo ayé ó dẹ̀ ti rí kó tó di pé mo dé Nàìjíríà. So gbogbo nǹkan tá a bá ń ṣe, sincerity is the best. Ẹ jẹ́ ká wà sincere pẹ̀lú nǹkan tá a bá ń ṣe. Another thing tí mo tún fẹ́ sọ kí n tó lọ tọ́pìkì wa tòní, ọkọ àtìyàwó, this is not the right time for you people to divorce, to separate. This is the right time to know the reason why you got married to your husband, the reason why you got married to your wife. Ìta níbẹ̀ yẹn kò ṣe múlà. Religion is like colonization. It's not to guide anymore. Religion is like colonization. You will see people that they are feeding on religion, no matter how old they are. Immediately they see anything tí wọ́n mọ̀ wípé ó lè la ojú èèyàn. Our Muslim, we are too aggressive. Why? Kí ló dé táwa Muslim fi wà too aggressive? Ẹ̀sìn yìí is not our surname. It's individuals deed. Nǹkan lánàá mo fi kíní yìí mo fi wégele. Lónìí mo fi ṣe hijab. It's my deed. It's not anybody's deed. I'm not doing anything to satisfy anybody. You are not doing anything to satisfy me. The moment you are doing things to satisfy me, then kẹ́tó mọ̀ nǹkan tó ń ṣẹlẹ̀. Ní gbọ́ra wa yé mọ́. We are doing religion to satisfy people. My religion is not to satisfy people. My religion is my deed. Àṣepamọ́ mi níwájú Ọlọ́run, ó ní ẹ̀sìn tí mò ń sìn. Tó jẹ́ pé kò sí ẹni tó mọ dédé bó ti ṣe tó, kò dẹ̀ sẹ́ni tó mọ máàkì tí mo score. Nínú ẹ̀sìn tèmi, is my little way of doing charity is part of my ẹ̀sìn. My little way of doing charity, my little way of being with people, my little ways of counseling people, my little way of sacrificing my time without taking any kobo. Olúkálùkù ló ní ọ̀nà títí tiẹ̀. But today, if you go to social media, ẹ máa rí, especially our Muslim, we are becoming something else on social media. Religion is not our surname. My own deed doesn't take you anywhere. It doesn't take you anywhere. Your deed doesn't take me anywhere. The glory comes to you, it comes to me. Whatever I'm doing, it comes to me, it goes to my children. Ọjọ́ tí mo ti ń ṣe dáadáa ní orí social media yìí, gbogbo ẹ̀yin fáǹsì mi, kò tí ì sí ọjọ́ tí wọ́n pàdé yín, tí wọ́n wá reward yín for that. Ọjọ́ tí mo bá sọ̀rọ̀ tí ò bá dùn mọ́ àwọn èèyàn, nobody has ever attacked you. They attack me. If I do anything tó bá dùn mọ́ àwọn èèyàn, people praise me. They gave me their praiser. Despite the fact pé ẹ follow me, you haven't taken any blow for me. I haven't taken any blow for you. But if I say something tó bá jọ mọ́ religion, people will come and be getting angry. Why? I only said it on my page. Wípé religion today, we argue too much over religion because we are seeing it like a way of colonizing each other. It's a way of me telling you, you must go this, you must do that. If I say anything, you didn't follow it, it didn't bother me. Torí kò túrun kankan lára mi. Inside my own house, I maintain my own peace. Nínú ilé àwọn ọmọ mi, they have their own peace. If I offer anything and you didn't follow it, kò túrun lára mi. It doesn't make me go gaga. It doesn't make me go angry. Tí mo bá sọ fún yín wípé ìrun, if you don't want to kiss, kò bother me. I don't canvas people's brain. What did I say? I don't canvas people's brain. Kí wá máa sọ, tó bá sì kí, it's your deed. You know what is good for you. You know what is better for you. The one you are doing, you know the reason why you are doing it. The one you are not doing, you know the reason why you are not doing it. I'm not ready to follow anybody for something that you are going to benefit from it. When we were going to school, a lot of people decided not to further the education. They didn't got the certificate I have. Àwọn kan ready àti lọ kọ́ṣẹ́. Àwọn ni wọ́n rán àwọn aṣọ yìí. Since I don't know how to run so, we didn't fight each other. Why are you fighting me? Anytime I say something about religion, why? What is the point in fighting me? I don't fight people. It doesn't make you bí ìgbà tó jẹ́ pé èèyàn Ọlọ́run ni èèyàn. No, àwa la rí bẹ́ẹ̀ yẹn. You shouldn't see it. When I write anything, I'm only using it to call people's back. Nobody can criticize God. You cannot criticize God. It's not possible. Nobody can criticize God. Even though you appraise God, kò tí ì wá bá ọ wípé appraiser tó ṣe fún mi o, I'm happy with it. Our God is imaginary God. Ọlọ́run ọba tá a rí, tá a ń sìn. Bólúkálùkù ṣe passive Ọlọ́run ọ̀tọ̀ọ̀tọ̀ ni. What is the problem with we Muslims? Everybody cannot go your way. Everybody cannot go your way. My page is not to colonize. And that is the reason. Ọ̀pọ̀lọpọ̀ ń sọ wípé kí n wá join kíní àwọn, especially àwọn scholar. Mo sọ fún wọn wípé no, I cannot join anybody's page because my talk is not permanent. My talk is not permanent. Tí Christian bá ṣe nǹkan lónìí, if it is not good, I talk about it. Tí Muslim bá ṣe, I talk about it. Ṣùgbọ́n tí mo bá lọ kóra mi sí ọ̀dà sheik kan tí ó wà máa sọ pé báyìí l'Ànábì wí, I don't want to know what Ànábì say. Why will I be referring to him? Ní the generation. Why? Why will I be referring to àwọn ìwé tán kọ ní 2000 years ago, to 400 years ago? A lot of things have been outdated nínú rẹ̀, but we don't want to see it that way. And bí ìgbà tó jẹ́ pé we want to be living in 400 years while we're wearing 2026 clothes. I don't quote scripture. I don't quote scripture. I don't quote scripture. So I don't want religion people coming to my page. It usually make me look somehow. I don't want religion people coming to my page. I always said, people, instead of people seeing religion as a way of guiding people, it's not like a way of colonizing. If you don't go this way, people will be against you. Please. Ẹ bá mi pè àwọn èèyàn. I don't know, maybe people are not getting me right, or people just want to be adamant, or people just stick to what is in their brain. Bóyá ìyẹn ni àwọn èèyàn stick to ni. A ti sọ̀rọ̀ nípa cancer so many times. Kò láti sọ̀rọ̀ nípa cancer. But it seems, bóyá torí tí a bẹ̀rù ikú, ẹ̀yin èèyàn mi, ẹ má bẹ̀rù ikú. Kí lẹ ń bẹ̀rù ikú fún? We are going to die. A máa kú. Either we like it or not, a máa kú. Gbogbo ọ̀nà lọ́lọ́run fi hàn wá. Wípé kò sí ẹni tí yóò jù sílé ayé. Kò dẹ̀ sí èèyàn tí yóò kú tí ò ní kinní kan tí yóò fà lọ́wọ́. Orí ó fọ́yàn, ẹ̀dọ̀ ó dùnyàn, ojú ó dùnyàn, àyà ó dùnyàn. One day, gbogbo wa máa kú. Àwọn kan wà wọ́n máa dàgbà. Àwọn kan wà wọn ò ní dàgbà. Àwọn tí ó dàgbà yẹn, what is the reason? Ìyẹn gangan ló yẹ ká fojú tó, but a ti máa ń gbọ́n jù. A ti máa ń gbọ́n jù. A ti máa ń gbọ́n jù. Torí tá máa ń gbọ́n jù, kò jẹ́ ká lè take in anything on our head. Today we run here to go and ask questions. Tomorrow we run there to go and ask questions. Next tomorrow we run over there to go and ask questions. Ọ̀pọ̀lọpọ̀ ìgbà, àwọn èèyàn wá sọ fún mi, mo ti lọ hospital mẹ́ta, mo ti lọ hospital mẹ́rin, ṣùgbọ́n n ò rí ṣe. Stick nínú nǹkan tí ò kí ń jẹ́ ká ní accurate diagnosis of this cancer is moving from one place to another. Moving from one hospital to another. Moving from one ilé alágbo to another. Moving from one orí òkè to another. Moving from one herbalist to another. Moving from one afa to another. We never stick to anything tó bá ń ṣe wá wípé ká treat ara wa religiously. yes, ká treat ara wa religiously, a máa sáká, then a ti lè gba ìmọ̀ràn jù from different people is one of the causes tí ò kí ń jẹ́ kán lè tackle cancer yìí. Kò síbi tí cancer ò sí o, all over the world. Kò dẹ̀ síbi tí wọn ò ti kì í ṣe late diagnosis, nítorí tó jẹ́ pé àìsàn mẹ́wàá ó lè ní one sign and symptom, in which tó jẹ́ pé màá gbìyànjú kí n tún ṣàlàyé fún wa from beginning to the end. Màá gbìyànjú kí n ṣàlàyé fún wa from beginning to the end. Mo máa ṣàlàyé fún wa. Cancer tá à ń sọ̀rọ̀ rẹ̀ yìí, kí ni cancer? Group of àìsàn ni. Nǹkan ẹyọ kan ṣoṣo òun ló sì ń àtàkì nínú ara wa, òun ni cells of our body. Normal cell òun ni mo fi sí ojú ewé mi yìí. Bí normal cell ṣe máa ń rí nìyí, yóò kọ zero, yóò dẹ̀ smooth. Ṣùgbọ́n tó bá ti ń di abnormal cell, yóò mọ yà lóríṣiríṣi, yóò yà báyìí tí yóò lọ́wọ́ tí yóò lẹ́sẹ̀. Kí ni nǹkan tó ń fà á? Ṣé cancer yìí sí àwọn ìran kan ló ní ni? Cancer pọ̀ lọ́dọ̀ àwa black, especially prostate cancer, ó pọ̀ lọ́dọ̀ àwọn ọkùnrin wa. Gbogbo ilé ayé òní cancer ti pọ̀. Ẹ jọ̀ọ́ ẹ jẹ́ kí n ṣí window mi. Gbogbo ilé ayé òní cancer ti pọ̀. Ẹ jẹ́ kí olúkálùkù a ti lè gba advice jù ní ọ̀dọ̀ àwọn èèyàn. When you are treating one ailment and it's not going, stop going to different hospitals. Go to teaching hospital and stop deceiving yourself. If it turn out to be cancer, you will end up in teaching hospital. Nínú àwọn sign and symptom tí a máa ń fojú parẹ́ ó ní indigestion. Mi fẹ́ anybody kó wá padà wá page mi kẹ́ má jẹ́ kí n sùn, kẹ́ má sọ pé what do you think I can do? I've been having indigestion for the past kìíní now, because we panic too much. Our education doesn't show in our behavior when we are dealing with things. Gbogbo nǹkan kọ́ la lè rí solution sí, but you can manage so many people, so many things. In the process of looking for permanent cure, when there is no permanent cure for it, that is when we mismanage and misdiagnosis máa ń sábà ń ṣẹlẹ̀. Tí wọ́n bá sọ pé ká sọ̀rọ̀ nípa cancer generally, it could be cancer of the brain, cancer of the eyes, cancer of the nose, cancer of the mouth, cancer of the throat, cancer of the lungs, cancer of the stomach, of the colon, of the liver, of the kidney, cancer of any part of the body, cancer of the cancer of the fat wà, cancer of the bone wà, sarcoma, cancer of the blood wà, leukemia. Kí ni nǹkan tó ń fà á? Kò sí ẹni tí ò lè ní. Ọ̀pọ̀lọpọ̀ àwọn èèyàn, mo make small clips nípa rẹ̀. A lot of people have been sending me, what test can I do to detect if I have cancer? What is the permanent solution? Relax. Gbígbọ̀n tá ń gbọ̀n ká gan, ó ń change, ó ń jẹ́ kí mutation kó wà nínú àgọ́ ara wa. A ti lè gbọ̀n jù, especially àwa Yorùbá. Àwa Yorùbá la máa ń lóògùn fún àìsàn tí a ní. Yorùbá ló máa ń lóògùn fún àìsàn tí a ní. A lọ lo àgúnmu, alágúnmu á lọ lo àgúnmu tí yóò pa jaundice, àgúnmu tí yóò pa jẹ̀díjẹ̀dí, àgúnmu gbogbo nǹkan tí wọ́n kó sínú kinní yìí can change the mutation of the DNA of your cells. That is chemical reaction. A ti lè lo oògùn jù. Then ìgbà ní ẹ̀yìn ikú Ògògó, Ọlọ́ọ̀ba kó ṣàforíjìn fún tí ẹnìkan jáde tó sọ pé n ò kí ń treat èèyàn dáadáa, tí mo wá rí níbìkan tí wọ́n sọ pé ó lóun máa ń lo alábùkún àti ọsàn wẹ́wẹ́. Mo wá sọ̀rọ̀ nípa rẹ̀. To God who made me, messages tí mo receive ní orí ibẹ̀ yẹn, later I stop reading messages because it will discourage me of what I'm doing. Then you will now start thinking, wípé sí àwa dúdú, especially àwa Yorùbá, do we actually have ọpọlọ? Ṣá ní ọpọlọ? It is not poverty. And I won't call it ignorance. I will call it too much. Ìyẹn náà ló dẹ̀ ń dààmú wa nínú ẹ̀sìn lónìí. Ìyẹn ló ń dààmú wa nínú ẹ̀sìn. Everybody wants to colonize everybody's brain. One old man was sending to me, wípé ṣé mo ń ṣiṣẹ́ fún àwọn CIA ni. I don't know the stupid CIA he's talking about. At my own age. Kò sí nǹkan tán fowó ṣe láyé tí mi ti fowó ṣe. I've never had money, but the little I had, I manage it. The little kínkínní tí Ọlọ́run ṣe fún mi through iṣẹ́ tí mò ń ṣe, I manage it. I did everything that needed to be done with the little money. So I'm not coming on this social media to collect money. I'm not an hungry author. I'm not an hungry scholar. Mi kì í ṣe àwọn àfáà tẹ́bi ń pa tí wọ́n ń gba owó ká tó fi ń kàǹfàsì orí àwọn èèyàn. Who are the CIA that I have to go and be collecting money from them to be talking against religion? A stupid person was sending that stupid message to me. Are you being sponsored by the CIA to against religion? I don't know when religion become our surname. It's not anybody's property. God is not anybody's property. God is for every one of us. I can handle God the way I want to handle him. You can handle him the way you want to handle him. But àwa dúdú, when there is any ailment in us, ẹ jẹ́ ká treat it accordingly. A ti lè lo oògùn jù. Oògùn tá ń lò ó wà nínú nǹkan tó ń ṣe tó ń change body chemistry wa. Ẹ jẹ́ ká padà. Then tí mo bá ṣe kinní kan nísìnyí, everybody tẹ́ bá ti like mi, ẹ mọ̀ sọ wípé ẹ lọ wo oògùn tálágbájá ṣe. Because you like me doesn't mean that what I produce is authentic. Èèyàn kan ṣoṣo ò kí ń dá oògùn àìsàn ṣe. Èèyàn kan ṣoṣo kò lè dá oògùn àìsàn ṣe. Company kan yóò tà fún another one. Tẹ́ bá wá wo iye èèyàn tí wọ́n ṣe research ní orí oògùn yẹn, they may be more than millions. Ọ̀tọ̀ ni àwọn tí wọ́n kó egbòogi jọ, ọ̀tọ̀ làwọn tí wọ́n fọ̀, ọ̀tọ̀ ni àwọn tí wọ́n bá fọ̀ tán tí wọ́n wò kí làwọn fi fọ̀, ọ̀tọ̀ làwọn tí ó gun, ọ̀tọ̀ làwọn tí wọ́n extract oró tó wà níbẹ̀, ọ̀tọ̀ làwọn tí wọ́n ṣe quality care rẹ̀ tí wọ́n check ẹ̀, oró wo ló wà ń bí, iṣẹ́ kí ló ń ṣe, kí ni wọ́n kàn sí, ẹnìkan kàn dáde dìde yóò dẹ̀ ṣe, yóò fi ẹ̀pà yìí yóò fi ṣe oògùn, everybody ó sì mọ̀ sọ pé it's good. And you people expect me to now be advertising that. Ìwọ nìkan ló dá ewé wà, ìwọ nìkan ló dá egbò wà, ìwọ nìkan ló dá ṣe, ìwọ nìkan ló lórúkọ, ìwọ nìkan ló ní NAFDAC. Ibo ló ti test ẹ̀? Èèyàn mélòó ló fi ṣe research ẹ̀ tí yóò wá sọ fún mi? After any new development of any medication, drug medication, wọ́n kó àwọn èèyàn jọ wọ́n fi sínú omi fáwọn kan wọ́n fi placebo sínú omi fáwọn kan tó bá jẹ́ pé cancer ò ní wọ́n fẹ́ fi treat ok àwọn nílé tí wọ́n ṣe diagnosis stage 1 stage 2 nìyí wọ́n mọ̀ wò ó wọ́n mọ̀ lò fún wọn wọ́n mọ̀ ṣe test ní every day is it improving the cells is it killing the cells is it killing the cells ṣùgbọ́n ẹ kàn wá gbé wá ẹ wá sọ pé go and Google about it I don't need to Google I read the journal I don't just come out bẹ́ẹ̀ ni clinic trial I read journal èyí tí wọ́n ṣe last new cancer cell drug tí wọ́n ṣe last ọmọ mi wà nínú àwọn tó ṣe I'm not being naive of what I'm saying I'm not being naive of what I'm saying tá bá fẹ́ sọ̀rọ̀ cancer generally ó ti máa ń wà lágọ̀ọ́ ara wa for long tí a ní mọ̀ wípé ó ti wà ó máa ń fún wa ní àwọn sign and symptom ṣùgbọ́n symptomatically ó la máa ń treat àwọn sign and symptom yìí ó ló máa ń jẹ́ kó dàgbà mọ́ wa lọ́wọ́ ó ló máa ń jẹ́ kó dàgbà mọ́ wa lọ́wọ́ ẹ jẹ́ ká bẹ̀rẹ̀ according to wọ́n sọ pé cancer àkójọpọ̀ àwọn àìsàn tó jẹ́ pé ó lead to DNA mutation yẹn ni wípé kó change nǹkan kí n fi nǹkan kan kó hit bí nísìnyìí all of a sudden instead bí mo ṣe dúdú níbí kí bí kó wá pupa tàbí kó grey nǹkan tó ń ṣẹlẹ̀ nínú cells of our body nìyẹn. Multiplications, growth, excessive growth, and divide of the cells. Multiplication of cells, yóò wà. Anything that has beginning must have end. Any cell tí wọ́n bá bí lónìí, ẹ rí wípé níbi inú kíní yín, nínú ọgbà yín, ẹ kàn lè jáde lónìí nǹkan ìdéwájú ìta yín, kẹ́ bá àwọn kóńkó tí wọ́n ṣẹ́kù tó jẹ́ pé wọ́n yóò mọ wọ̀nyàn ó dẹ̀ lè di oṣù tó ń bọ̀ kí wọ́n ti withered away láì jẹ́ pé bóyá ẹ pa láì ṣe nǹkan kan wọ́n withered away toró ní dèdè ibi tí rúùtù wọn lè lọlẹ̀ mọ́ wọ́n withered. The same thing is happening to the cells of our body. Any cell tí wọ́n bá bí nínú àgọ́ ara wa lónìí it will die within 120 days. Exactly 120 days yóò kú ṣùgbọ́n àwọn kọ̀ọ̀kan wà tó jẹ́ pé tí ò bá kú gbogbo ẹ̀ yẹ kó kú èyí tó bá kọ̀ tí ò kú yẹn òun ló máa ń di cancer mọ́ wa lára. At times it may be as a result of genetic inherited genes from our parents. It may be environmental kó jẹ́ pé environment wa ni. It may be infection. It may be as a result of age. It may be as a result of hormone. So many things can cause it. Ẹ jẹ́ ká wo genetic. Ṣùgbọ́n nǹkan tí wọ́n fi ń sọ pé idiopathy ni wípé tí wọ́n bá diagnose mi pẹ̀lú cancer nísìnyí n ò lè sọ fún mi wípé nǹkan tó cause ẹ̀ nìyí. Tẹ́ bá dé oncology department ẹnu kan tí wọ́n mọ̀ béèrè lọ́wọ́ yín ni pé any family history bẹ́ẹ̀ ni lifestyle any family history of cancer tẹ́ bá sọ pé ó wà wọ́n mọ̀ fojú inú wò ó maybe you inherited some genes like a BRCA1 BRCA2 MLH1 kí ni nǹkan tí àwọn kìíní yìí ń ṣe tán bá test téèyàn bá wà positive for BRCA1 BRCA2 MLH1 àwọn ìyẹn ó ní kò kí ń jẹ́ kí àwọn sẹ́ẹ̀lì yìí kí wọ́n kú ní àsìkò tó yẹ kí wọ́n kú. Bí inherited gene ok àwa kan wà tó jẹ́ pé aga moderately àwọn kan wà tó jẹ́ pé wọ́n ga, àwọn kan wà tí wọ́n ṣe àràrá tí wọ́n ṣe dwarf, àwọn tí wọ́n ṣe àràrá yẹn kinní kan ni wọ́n inherit ní ọ̀dọ̀ parent wọn tí ò jẹ́ kán ga exactly bẹ́ẹ̀ náà lọ̀rọ̀ cancer rí. Kinní kan ò lè yán inherit lọ́dọ̀ parent èèyàn lọ́dọ̀ family èèyàn tí ò jẹ́ kí àwọn sẹ́ẹ̀lì tó yẹ kí wọ́n kú ní àsìkò tó yẹ kí wọ́n kú. Tí sẹ́ẹ̀lì yìí ò bá ti wá kú, kí ni yóò ṣe? Yóò máa gbilẹ̀, yóò kọ́kọ́ dúró bíi 60, kò ní ju kékeré báyìí lọ. Yóò dúró bíi benign, bíi kókàn rèé nísìnyí. All of a sudden kẹ wá rí pé ó ń tóbi, ẹ wò bí mi sọ pé keloid cancer ni o, torí àwọn kan orí ọ̀rọ̀ ni wọ́n máa ń gbé. Ẹ wo àwọn tí ara wọn máa ń ré yẹn, nígbàrà tí egbò bá ń san yóò kọ́kọ́ jáde kínkínní, yóò wá mọ expand exactly bí cancerous cell bó ti ṣe rí nìyẹn. Ní ibi ó kọ́kọ́ máa ń wà localize, ó lè jẹ́ pé bóyá orí liver ni, bóyá orí kidney ni, bóyá stomach ni. Bí normal cell bó ṣe máa ń rí lára olówà lẹ́yìn nìyẹn. Ẹ rí i pé wọ́n kọ normal cell, tẹ́ bá wá wo ìsàlẹ̀ rẹ̀ níbi tí wọ́n kọ cancerous cell sí, ẹ wo bó ti ṣe ṣe. Ẹ rí i pé ó bẹ̀rẹ̀ sí ní ya gbòǹgbò lóríṣiríṣi. Ẹ jẹ́ kí ẹ rí bó ṣe ṣe. Ẹ wò ó bẹ̀rẹ̀ sí ní ya gbòǹgbò, ó bẹ̀rẹ̀ sí ní lọ́wọ́, ó ń lẹ́sẹ̀, ó ní apá, ó ní tan, ó bẹ̀rẹ̀ sí ní ṣe báyìí bí ìgbà tó jẹ́ pé èèyàn ya nǹkan. Ṣùgbọ́n normal cell olówà lẹ́yìn ìwà yìí tó jẹ́ pé smooth, ó round. Ibi tó wà tó ṣe nínú rẹ̀ yẹn tí wọ́n paint òní nucleus. Ibẹ̀ yẹn gangan òun ni ó máa ń change. Ibẹ̀ yẹn gangan ní DNA rẹ̀. Kẹ́ tó mọ̀ nǹkan tó ń ṣẹlẹ̀, yóò bẹ̀rẹ̀ sí ní hu ìtàkùn, yóò máa hu ìtàkùn, yóò wá máa kọwọ́ bọlẹ̀, kò ní kúrò níbẹ̀. Multiplication yóò wá máa wà. Òun la fi hàn wá ní ibí yìí. I just want us to be liberated. Àwọn ọmọ mi ti dé bí o. Níbo ni wọ́n tún kó kinní yìí sí fún mi? Oh God. Ẹ jọ̀ọ́ ẹ jẹ́ kí n wá níbí yìí. Okay. Mi rí, ṣùgbọ́n ẹ jẹ́ kí n fi eléyìí, ẹ jẹ́ kí n fi parẹ́. Ó lè jẹ́ kọ́kọ́ mi ló bá mi kó pamọ́ lẹ́yìn. Gbogbo wa là ń rí wípé normal cell nìyí. Cell rí mi báyìí. Normal cell, bí normal cell ṣe rí nìyí. Sáàkù ni. Bí normal cell wá ṣe rí nìyí. Sáàkù ni. Ṣùgbọ́n ní ìgbà tí ó bá ti ń change DNA, ó wá ń ṣe báyìí. Sẹ́rí, nígbà tó yá yóò di báyìí. Tó bá yá yóò di báyìí. Yóò wá ní àwọn ọwọ́ bó ṣe wà yìí, ó ní blood vessels tó jẹ́ pé ní organs tó bá ti fi ara bọlẹ̀ yóò wá wu ìtàkùn. Ìtàkùn tó bá wù yẹn, either in any way tí cancer yẹn bá fi wọnú àgọ́ ara wa, the first place tó lọ ń ṣe ni wípé yóò attack the cells of our body. Tó bá ti attack cell yìí, yóò wá máa hù, òní wọ́n ń pè ní tumor. Tumor tó bá hù lára wa tí kò sí cancerous cell níbẹ̀, òní wọ́n ń pè ní benign. Ṣùgbọ́n téèyàn bá ní benign, wọ́n máa lọ ń check rẹ̀, kán wo àsìkò. Téèyàn bá ní benign, ó lè change, kán wo àsìkò tó jẹ́ pé cells of that tumor will be changing. Ṣùgbọ́n àsìkò yẹn tí wọ́n bá ti wò ó lónìí, tí wọ́n ti wò ó lóṣù mẹ́fà, tí ò bá ti sí nǹkan kan, nítorí owó kéékèèké tí à ń san, a ní padà lọ teaching hospital mọ́. Kò kí ń ṣe pé bẹ́ẹ̀ náà ni teaching hospital wa burú tó. Àwa la kì í lọ. Then we waste time too much. Nítorí tó jẹ́ pé ìgbà yẹn a bẹ̀rẹ̀ sí ní máa béèrè advice ká from different people. It is in you. Tó bá jẹ́ pé genetic ni, then they will be monitoring you. They will be monitoring you. Wípé okay, ṣé kinní yìí tó bá wà báyìí, ṣé kò tóbi ju bó ti ṣe yẹ kó wà lọ? Ṣé DNA rẹ̀ ṣé kò change? Wọ́n mọ̀ gbogbo ní ìgbà gbogbo. Ìgbà yẹn ò la máa lọ ń kó bára wa tí a lọ máa ra oríṣiríṣi egbògi, oríṣiríṣi oògùn tí a máa lò. Environment, our lifestyle wa is causing a lot of atrocity in our life. À ń mu ọtí, à ń mu sìgá. Wọ́n ń pe kinní kan ní àdìmẹ́nu. Ó pẹ́ tí àwọn èèyàn ti ń sọ fún mi wípé talk about this àdìmẹ́nu, talk about this àdìmẹ́nu. Mo lọ wo àdìmẹ́nu and now look at it. What are we looking for? Kí ni nǹkan tá à ń wá? Kí ló sọnù lọ́wọ́ wa? Nínú àdìmẹ́nu yìí, páàdì kòkó tó jẹ́ pé tí wọ́n bá ti wọ̀ ọ́, tí wọ́n kọ́ọ̀tì ẹ̀ báyìí, tí wọ́n wọ tinú rẹ̀, tí wọ́n ń sọnù, páàdì kòkó yìí wà nínú nǹkan tí wọ́n fi ń ṣe. Àṣà ó wà nínú nǹkan tí wọ́n fi ń ṣe. Kí ni kúrí ògùn tí ẹ̀ ń gbé sẹ́nu tí wọ́n sọ wípé ọ̀ lè gbé mi? Then where is going to absorb? But nǹkan tí ò yé wa ni pé even despite the fact that you didn't swallow it, ẹ mọ̀ wípé ní ibi sublingual oògùn kan wà tí wọ́n máa ń lò tán pè ní sublingual. Sẹ́rí blood vessels tó wà ní ibi yìí bíi blood vessel tó wà níbi ògòló wa ni. Àwọn oògùn kan wà tó jẹ́ pé tí èèyàn bá ń kú lọ, tí ó bá kan, tó bá fi sí abẹ́ ahọ́n, tó bá lè met within 2 minutes yóò ṣiṣẹ́. Nítorí tó jẹ́ pé blood vessels ó pọ̀ níbí yìí. Blood vessels pọ̀ ní abẹ́ ahọ́n wa. Blood vessels pọ̀ ní ibi tá a ti ń yàgbẹ́. Ní ayé ọjọ́ nígbà tí convulsion jẹ́ convulsion, tẹ́ bá fi ọwọ́ kan dá sẹ́pà injection, tẹ́ bá fi bọ ìdí ọmọ báyìí, ara rẹ̀ máa wálẹ̀ immediately ni. Tẹ́ bá fún ní over, tẹ́ bá ṣe é síbẹ̀ ju bó ṣe yẹ ká ẹ ṣe lọ, ọmọ yẹn máa give up straight away ni. Nítorí tó jẹ́ pé ẹ ń fi síbẹ̀ báyìí, blood vessel máa gbé lọ́nú blood directly ni. The same thing is happening here. Gbogbo èyí tẹ́ ẹ mu àdìmẹ́nu is another lifestyle that can give us cancer. Chemical reaction in our body. À ń mu sìgá. Gbogbo àwọn nicotinic acid tá à ń mu, wọ́n lè overreact pẹ̀lú DNA of our body. Then it will cause mutation, multiplication, excessive multiplication, and it won't allow that cells to die when it's supposed to die. Any cell that didn't die after 120 days, ó fẹ́ gbalé lọ́wọ́ èèyàn ni. Ẹ wo tá bá ní àgbàlagbà tó yẹ kó kú tí ò kú, ó máa lo ayé ti yín mọ́lú. Oníyà 100 years, 120, kò ní jẹ́ kí ìwọ gangan kò lọ, kò sì ní jẹ́ kó ráyè rẹ̀ ṣe. Yóò wá di burden sí ara everybody. Bẹ́ẹ̀ ni, yóò di burden. Bẹ́lẹ̀ yìí ṣe ń gbé ni tọ̀hún ó máa gbé. Yóò wá padà sí ọmọ kékeré. You must cook in the morning, you must cook in the afternoon. Exactly. Iṣẹ́ cancer nù nínú àgọ́ ara wa. Tó bá ti lè kí ìtàkùn bọ́lẹ̀, yóò máa extract gbogbo food nutrients, oxygen tó yẹ kí neighboring organs tó yẹ kó gbà, òní yóò gba gbogbo ẹ̀. Then ọ̀pọ̀lọpọ̀ wa àwọn oògùn tí à ń lò, àwọn ọmọ wa gbogbo wọn ni wọ́n ń lo egbògi olóró. I'm very sorry. Ṣùgbọ́n àwọn ọmọ tí ẹ̀ ń fi ojú ó ní wò nínú ilé, tẹ́ bá mọ ìwà tí wọ́n ń hù níta, ara abiyamọ ta yín. Look at, ẹ wo bí kidney failure, ẹ wo bó ṣe pọ̀. Ẹ wo bí liver failure, ẹ wo bó ṣe pọ̀. Kí ni nǹkan tá à ń jẹ? Ṣé gbogbo kẹ́míkà ayérayé ò ní wọ́n ń dà sínú iṣu ni? Ṣé gbogbo kẹ́míkà ayérayé ni wọ́n ń dà sínú ẹ̀gẹ́ ni? Ṣé gbogbo kẹ́míkà ayérayé ò ní wọ́n ń dà sínú àgbàdo, ọkà bàbà, mílẹ̀tì tá à ń jẹ ni? We are not eating this chemical directly. Gbogbo wa là ń sọ wípé nítorí hormone tí wọ́n fi sí gbogbo àwọn nǹkan, ẹran mélòó gan là ń jẹ? Lifestyle wa ó ń kó bá wa. Àwọn kan sọ fún wọn kọ sí orí péjì mi wípé wọ́n ń fi Lipton tea Lipton wọn ò mọ nǹkan tán gún sínú Lipton caffeine wà nínú Lipton caffeine is like adrenaline wọ́n bọ́ìlì caffeine wọ́n bọ́ìlì Lipton tea wọ́n wá fi chloramphenicol sí wọ́n wá fi ọsàn wẹ́rẹ́ sí oògùn ibà nìyẹn lọ́dọ̀ ẹlòmíì kò pa ibà yẹn tí wọ́n bá ti lò ó ara wọn máa ṣe yágíyágí wọ́n á dìde why nítorí caffeine tó wà ń bẹ̀ kò pa ibà yẹn ṣùgbọ́n ìnídélé tí wọ́n bá ti lò ó torí tí caffeine wà ń bẹ̀ wọ́n làágùn wá then more blood vessel will be well dilated there's going to be more cortisone then energy yóò wà then they will be able to stand up and be doing their day-to-day activities but the malaria didn't go the typhoid didn't go before you know what is going on in the next 2 weeks the malaria will come back and they will repeat the same thing. Mo wà surprise nǹkan tí ọ̀pọ̀lọpọ̀ ń sọ fún mi wípé àwọn fi ń treat malaria lime Lipton tea chloramphenicol ọlọ́jà wọ́n tún wá sè é lórí iná wọ́n wá mú all those things can change body chemistry there could be chemical reaction. That is another lifestyle tí à ń ṣe that is not expected. A máa ń fi àgbo papọ̀ mọ́ oògùn òyìnbó papọ̀ mọ́ ọtí. It can change the chemical, the chemistry of a body. It can change the body chemistry. Àwọn nǹkan kọ̀ọ̀kan wà, egbòogi kọ̀ọ̀kan wà tó jẹ́ pé they didn't go together. Tẹ́ bá lò ó ẹ gbọ́dọ̀ lò yìí but kò sírú rẹ̀ ní app wa a lọ kó igi sínú kinní a dà ọtí sí ó wà intoxicating gbogbo irú eléyìí bad lifestyle ni we didn't see inside us kò tí ì sí ẹni tí ó kú tí wọ́n la inú rẹ̀ kí wọ́n rí bí léyàsí ara wa ti ṣe rí léyàsí ẹran nìkan là ń rí tá a bá mu kinní yìí inú nǹkan wa ló ń lọ tó bá dé inú nǹkan wa chọ́nì yóò ṣẹlẹ̀. The last time I talk about alábùkún is acetyl salicylic acid aspirin group ni alábùkún fúnra rẹ̀ is not supposed to go inside your tummy, empty tummy. If you have gastritis, you're not supposed to take alábùkún, ibuprofen, diphene. Gbogbo àwọn non-steroid anti-inflammatory, you're not supposed to take it. Tá bá mú ẹni tó mú alábùkún àti ọsàn wẹ́rẹ́ is corrosive to the tummy. Arabi tí chemical reaction tó ti máa ń wà nínú àgọ́ ara wa nìyẹn. Very bad lifestyle. Tẹ́lòmíì bá jí láàárọ̀ yóò gbé omi gbóná yóò wá lọ bẹ ọsàn wẹ́rẹ́ tó pọ̀ yóò wá máa fún sí yóò nítorí kíkùn kó bàa lè flat. I've never taken anything. I have flat tummy. You know why? I look after myself. I know I will die, but I want to be healthy. Mo mọ̀ pé máa kú, kí ló dé tí mi ní kú, but I want to be healthy. Nínú ìyẹn, tẹ́ bá ti fún sí citric acid, ó wà corrosive, is good for healing. But it can also destroy the stomach lining. Anything tá bá ti jẹ, hydrochloric acid will be secreted nínú ikùn wa. function mẹ́ta bí méjì òun ni hydrochloric acid ń ṣe nínú nǹkan wa. Either you like it or not, you don't like it, it will be secreted because it's going to perform the function. Òun ni kó kill any bacteria tí a bá gbé pẹ̀lú oúnjẹ, bóyá àkókò oúnjẹ wa dáadáa ni, bóyá a jẹ with fruit ni, bóyá a mú nínú omi ni. Hydrochloric acid will perform the first function by rendering it harmless, and if it could not, then the remaining will be passed to where it's supposed to. Then yóò jẹ́ kí stomach lining kó lè churn oúnjẹ tá a bá jẹ to aid digestion. Ó wà nínú lẹ́yìn tí stomach lining wa tó bá secrete enzyme, hydrochloric acid will also be secreted. Ìgbà yẹn ni ikùn wa máa ń ṣe bọ̀m̀bọ̀m̀bọ̀m̀bọ̀m̀bọ̀m̀. Àwọn aràn tó rùn nínú ikùn wa is hydrochloric acid. Tá bá wá mu gbogbo ẹ̀ papọ̀, you continue doing it every day. Before you know what is going on, you will be having gastritis, you will be belching, you will be having indigestion. Then lẹ́yìn yẹn, gbogbo bí yóò mọ tàyàn, àyà yóò mọ tàyàn. It's telling you that your stomach lining, there is gastritis. I don't talk about what you can use. I can only advise you to do exercise. I don't take medication unnecessarily. I only do exercise. I'm not tall, I'm petite. I'm 5.3. I'm not tall. I'm not tall. I walk towards my tummy, even from day one that I had my baby. Then lẹ́yìn yẹn, environment wa ó wà nínú nǹkan tó ń cause ẹ̀. Ibi tẹ́lòmíì ti ń ṣiṣẹ́, dust pọ̀ níbẹ̀. Asbestos, kàn máa kó nǹkan dust all the time. Ó lè change DNA, especially àwọn asbestos yẹn. Àwọn nǹkan kọ̀ọ̀kan wà tó jẹ́ pé wọ́n wà hazardous to our health. Age náà wà ńbẹ̀. When we are growing older, a máa ní low immunity. It's not that we are not eating, but the cells of our body, our tissue, everything is getting old, is aging with us. Then infection. Infection causes cancer. Forget about it. Especially this human papillovirus, HPV. HPV to the neck of our cervix. And I keep on saying it, ní òní, bí cancer of the throat, ó ń pọ̀ sí. Ẹ̀mí ìsìná ló jẹ́ kó máa pọ̀ sí o. Bí HPV bó ṣe ń change cervical cell wa, bẹ́ẹ̀ náà ló ṣe ń change throat cell wa, especially àwa tó jẹ́ pé ẹ̀yin ọkùnrin ìkà. I'm saying it with no apology. Ẹ̀yin obìnrin ìkà. I'm saying it with no apology. Ẹ̀yin ọkùnrin tẹ́ mọ̀ wípé ẹ ní one sex partner. Ẹni níbí, ẹni ìyàwó mẹ́ta, ẹ sì ní girlfriend. And you are HPV carrier. But you don't even know. Tó bá ṣe tó bá sú ọ, you still tell your women to suck you. Ẹ fẹ́ jẹ gbogbo ayé. Àwa obìnrin, we are scared of being having orogún. We do everything to satisfy. Bẹ́ẹ̀ni, ẹ̀yin ọkùnrin náà ẹ ń lá pléètì, ẹ ń gbé mi, but pé ọkùnrin ńlá pléètì ọkọ obìnrin kò wà dangerous tó wípé obìnrin mu nǹkan ọkùnrin, especially ẹni tí ò kí ń ṣe ọkọ ẹ, especially ọkùnrin tó mọ̀ wípé ó ní different sex partner. Wọ́n ejaculate sí yín lọ́nà fún ẹ gbé mi with HPV. Kẹ́ tó mọ̀ nǹkan tó ń ṣẹlẹ̀, throat cancer is becoming rampant nowadays. Throat cancer is becoming rampant. Kẹ́tó mọ̀ nǹkan tó ń ṣẹlẹ̀, lumps ti form. Gbogbo irú àwọn nǹkan báyìí is causing cancer nínú àgọ́ ara wa. What can we do? Báwo la ṣe lè detect pé cancer wà lára wa? Ẹ má jẹ́ kí n tàn yín, it's difficult to detect. Lungs cancer from tuberculosis, from péyàn mu mu gbó, mu sìgá, mu oríṣiríṣi chemical reaction in your lungs. Ọkùnrin míì yóò jí láàárọ̀ kùtùkùtù, àwọn ògógóró kan wà tí wọ́n ti kì sínú ilé pẹ̀lú àgbo. Wọ́n tọ̀ báyìí ṣọ́ọ̀tì ni. Multiple sex partner ni mo sọ, mi ì sọ̀rọ̀ nípa kíní. Yóò gbé báyìí ṣọ́ọ̀tì ni, especially àwa tá à ń ṣiṣẹ́ alágbára. We need to eat more food. Eat more food. Téèyàn bá ń ṣiṣẹ́ alágbára, what you need is carbohydrate, energy, not energy from chemical. Gbogbo àwọn oògùn olóró tá a mu, àwọn gọ́ọ̀mù, àwọn kinní kan, they have they exchange their chemical to our cells. Báwo la ṣe wá fẹ́ mọ̀ tá a bá ní cancer? Ó difficult àti diagnose o. Nítorí tó jẹ́ pé symptomatically ó ní wọ́n máa ń treat wọn. Gbogbo wa la mọ̀ wípé all our organs inú ikùn níbí ló wà. Liver, kidney wa ó wà níbi ẹ̀yìn, ìfun wa, stomach wa, heart wa, then lungs wa ó wà ní ibí. Uterus àwọn obìnrin ó wà ní inú eegun ìdí wa. Ṣùgbọ́n tá a bá ní uterine cancer, tá a ní ovarian cancer, tá a ní fallopian tube cancer, coffee is okay, but don't take it excessively. Taking coffee is okay. Kíní yìí yóò padà grow tí yóò wá sí inú ikùn wa báyìí. Tó bá ti wá sínú ikùn wa, ó máa ń fún wa ní indigestion. Ọ̀pọ̀lọpọ̀ ìgbà tí àwọn èèyàn bá wá bá mi tí wọ́n sọ fún mi wípé mo ní indigestion, mo ní ulcer, mo máa ń bèrè lọ́wọ́ àwọn èèyàn wípé where was the ulcer diagnosed? Wípé a ní ulcer yẹn, ó máa ń jẹ́ kí cancer kó go out of hand kí wọ́n tó get here. Tí èèyàn bá ní persistent indigestion tó jẹ́ pé ìgbà gbogbo ó ní indigestion, go to the hospital. There's nothing bad if you go to the hospital. They carry all the necessary tests and they say everything is okay. But àwa tá bá ti lọ sí hospital, tá ṣe léyìí tí wọ́n ló dá, mo kàn lọ waste owó ni. But the money you are using to go to party is being wasted than the money you spent on yourself. Ọ̀pọ̀lọpọ̀ wa hospital gangan ló ń pa wá, ṣùgbọ́n àwa gangan là ń para wa. Thank you Facebook, thank you. No, lipoma is connection of fatty tissue. Lipoma is connection of fatty tissue. Tí wọ́n bá là báyìí fat ni wọ́n rí bẹ́ẹ̀, but ó yẹ kéèyàn ó lọ yọ kúrò. Ó yẹ kéèyàn ó lọ yọ. Lipoma is collection of fatty tissue. Wọ́n kàn là báyìí, wọ́n sì ya gbogbo fat yẹn kúrò ńbẹ̀, wọ́n sì rán padà. Silocaine ni wọ́n fi ṣe lipoma. Thank God. Sorry, mi kì í sábà ń gbójú sókè. I don't want to read comment. That is the reason I don't gbójú sókè. We need to be checking ourselves. ọ̀pọ̀lọpọ̀ wa la máa ń sọ pé a ní ulcer but we didn't have ulcer. You cannot diagnose ulcer yourself. Èèyàn lè ní acid reflux ṣùgbọ́n kọ́ ọmọ ní ulcer. Ulcer ò ní egbò. Mo ní stomach ulcer. Ó confirm pé egbò wà nínú ikùn rẹ. Kí ló fa egbò yẹn nínú ikùn rẹ? You need to know. You may have gastritis and not have stomach ulcer, not have duodenal ulcer. Kó jẹ́ pé acid reflux nìkan lèèyàn ní. Tó bá ti ṣe àyà ó máa tààyàn, èyí ó máa belch. Àwọn kan wà tó jẹ́ pé they really have that stomach ulcer tí egbò wà nínú ikùn wọn. Egbò tó wà nínú ikùn rẹ̀ yẹn kí ló fà á? But we will not be treating, I have ulcer, I have ulcer, I have ulcer. But one ò ṣe gastroscopy. They didn't examine your stomach lining. It could be another thing. I don't think. It could be another thing. Òun ló fà á tí o fi ní bí indigestion. Tó fi ní indigestion. It could be another thing. Thank you. Ẹnìkan wà tó jẹ́ pé she treated herself for ulcer, but at the end of the day, cancer of the uterus lóní, of ovary, ó dẹ̀ dé one part of the uterus. Kíní yẹn dẹ̀ ti tóbi tó jẹ́ pé ó ti grow to the stomach. Ìyẹn ló ń push ìfun rẹ̀ tí ò jẹ́ kí good digestion kó wà. And she keep on telling me. Then I keep on telling her, did they do gastroscopy? Rárá, bó ti ṣe ń ṣe mí. When you go to the hospital, let them examine you. Let them do abdominal scan. If they couldn't find anything, let them do CT scan. Let them do MRI scan. Ibo ló wà? Òyìnbó ti ṣe gbogbo nǹkan tó jẹ́ pé kò sí ibi tó dúró sí nínú kọ́lọ́fín ara wa. They will figure it out. Ṣùgbọ́n a lè náwó bẹ̀, ṣùgbọ́n a lè náwó party. The only time we remember our government in Nigeria is when we are going to the hospital. When we are going to the hospital. When we want to do party, tí a party ti rẹ̀, kódà kíkùn wa máa fi báyìí ká mọ̀ nǹkan tó wà ńbẹ̀. Tá bá lọ sí hospital, if it is not going, the symptom continue, go to government hospital. Kí ni mo sọ fún yín? Go to teaching hospital. Go to Òkè-Òyì ní Ìlọrin. Go to LUTH ní Èkó. Go to UCH ní Ìbàdàn. Go to Ẹlẹ́yẹlé ní Ìbàdàn. Kò kí n ṣe wípé, see, people are frustrating me at times. Ní àná tí ẹ bá mọ iye test tí àwọn èèyàn send sí mi. Mi kì í ṣe andrologist. I'm a midwife. I'm not a gynecologist. I'm a nurse. I'm a tissue fiability. I'm a psychologist. I've never came out to tell anybody that I'm a doctor. Okay, why does everybody want me to diagnose them? A doctor cannot even diagnose all the ailments. Àfẹni tó bá fẹ́ pa yín nìkan ló yá mọ̀ kù. But you people never listen to me. What do you think we can use? Like someone said to me, my blood sugar is always low. Okay, when you eat and your blood sugar is getting low all the time, you need attention. They need to do different tests for you. Because you know the anatomy of the body, you know the physiology, doesn't make me to know everything about all the ailments in the body. I cannot specialize on the neuro or the ENT, on the tissue, on the muscle, lymphatic system, on the heart, on the colon, liver, kidney, sarcoma, bone, cancer of the bone. That is jack of all trade, masters of none. If you're a qualified medical personnel, you cannot be good ní gbogbo ọ̀nà. I can only do the anatomy, tell you the sicknesses that attach to this, the physiology, how it functions. I cannot treat all the ailments. And I've never came out to deceive anybody that I'm a doctor. I'm not a doctor. And I don't want to be referring people to any doctor. Why? I don't want to be referring. Because tẹ́ bá lọ bẹ̀ tẹ́nìyẹn lọ kú, ẹ padà wá bá mi, alájà náà lórí fún àwa síbẹ̀. No. Nínú accountability tèmi ní níwájú Ọlọ́run, ó ní ẹ̀mí ènìyàn. Nínú accountability tí mo ní níwájú Ọlọ́run, tẹ́rù máa ń bà mí nípa rẹ̀. I don't want to jẹ̀bi ẹ̀mí yín. No matter what you say, I will just ignore your talk. People will send to me, I will not even read it. Because I don't order for tests. What did I say? I've never ordered for one test. I don't order tests. I don't read. I only do that when I first started. Ṣùgbọ́n mo rí pé àwọn èèyàn abuse ẹ̀. Tẹ́lómi bá gbóǹfẹ̀ báyìí, wọ́n lọ ní àbáyé lab nìyẹn. Kódà some people will wake me up as early as 5 o'clock. Ẹgbẹ́ bá mi ka kíní yìí. I like ká take advantage ara wa. We make sure we take advantage of each other until that person is fed up of helping us. Ẹlòmíì ó tọ̀. Màmá ẹ jẹ́ kí n send kọ́lọ̀ ìtọ̀ mi fún yín. Tí sign and symptom nǹkan tó bá wà nínú àgọ́ ara wa tó continue, go to the hospital. Tẹ́ bá wá sí hospital mi tí mo treat yín tí ò lọ, go to teaching hospital. Ẹlòmíì ó sọ fún mi, mo ti dé tó hospital mẹ́ta, n ò rí ṣe, ẹ jọ̀ọ́ ẹ ràn mí lọ́wọ́. Tó bá dé tó hospital mẹ́ta tí n ò rí ṣe, what knowledge wo ni mo fẹ́ ní tó fẹ́ ju doctor mẹ́ta? But ọ̀pọ̀lọpọ̀ wa, we don't even see the doctors. We see the community health attendant. We see the community health aide. We see nurses. We see medical practitioners. We never see the specialties. Ká tó lè sọ fún yín pé ẹni stomach ulcer tí gbogbo wa máa ń diagnose ara wa yẹn, tá máa lògùn. They need to do gastroscopy kí wọ́n wá sọ wípé okay nínú ikùn yín yìí o, níbi large protuberance o, there is ulcer, there is excoriation, there is inflammation. Kí wọ́n wá sọ fún yín pé lo oògùn báyìí, padà wá after 6 months, wá check here, but we never go. Ṣùgbọ́n torí tí àyà ti ń ta wá, it may just be ordinary reflux. It may be because of the medication tá ń lò. Ó máa ń pẹ́ kán tó get cancer. Torí kò kí ń ṣe, cancer is not the type of sickness tó jẹ́ pé tẹ́ ẹ bá débẹ̀, the first thing tí wọ́n kọ́kọ́ query ó ní pé query cancer. Àfi tó bá jẹ́ pé ó wà obvious ní ìta, bí ọyàn, bí kórópọ̀n, bí eyín, bí ojú, bí kinní tó jẹ́ pé wọ́n rí. Astagfirullah, ẹ wo irú ìgbà tí wọ́n rí bàbá ẹlẹ́sọ̀ọ́, kí ni àwọn èèyàn sọ? They query it. They didn't confirm it. You don't confirm things until you do the test and test confirm it. Nǹkan tó mú àwa medically yàtọ̀ sí àwọn alágbo nìyẹn. Alágbo immediately tí wọ́n bá ti rí cancer lélẹ́yìí, it may not even be cancer. It may not even be. ṣùgbọ́n ní ọ̀dọ̀ tiwa, this is what you people don't like when you come to the hospital. You don't like clacking. You don't like history taking. You don't like to do tests. You don't like to come back. You don't like prognosis. Tẹ́ bá wá sí hospital, ẹ gba káàdì, ẹ wá bá junior doctor. Nǹkan tẹ́yin ò fẹ́ nìyẹn. Tẹ́ bá ti débẹ̀, àwọn doctor gbọ̀rọ̀gbọ̀rọ̀, àwọn doctor gbọ̀rọ̀gbọ̀rọ̀ náà ni yóò di doctor tí yóò padà mọ́, tí yóò mọ̀ sí operation. Ibo ni àwọn doctor gbọ̀rọ̀gbọ̀rọ̀, ibo náà ti fẹ́ mọ̀ bí wọ́n ṣe ń clacky. I remember when I was a student. Mi ti fẹ́ parí, I've never sutured episiotomy. Ìyá tó wá bímọ, èmi nìkan ni mo wà lọ́dọ̀ rẹ̀ ní night duty. Mo sọ fún màmá yẹn ni, mo ní màmá, mo ní ẹ̀ máa géèdì yín. Ọmọ ẹ̀gbẹ́ ni, ó yẹ wọn bá ti ṣe ọmọ mi. Ìwọ̀n bá ti ṣe. Mo ní ìran kìíní yìí rí, yìí sì gé. Mo gé, mo take delivery yẹn, mo sì rán, mo sì mọ ìgbà yẹn àti ẹ̀ máa ń fi potassium permanganate, a máa fi ń ṣe sit bath. Títí tí màmá yẹn tí wọ́n fi discharge ẹ̀. That is not allowed here. Katana, Gabriel Katana, that is not allowed. We don't vote. Ọ̀pọ̀lọpọ̀ àwọn tẹ́ ẹ lọ ń bá, they don't even know what they're supposed to do for in your body. Tẹ́lẹ̀ yìí bá ti ṣe, tí ò bá tún ti ṣe, wọ́n tún ṣe test míì. That is hospital. Wọn ò ní ṣe gbogbo test kan lẹ́ẹ̀kan ṣoṣo. Wọn ò ní ṣe gbogbo scan kan lẹ́ẹ̀kan ṣoṣo. Test tí wọ́n bá ṣe lónìí, òní yóò suggest the next test. Scan tí wọ́n bá ṣe lónìí, òní yóò suggest another scan tí wọ́n bá fẹ́ ṣe. Tí wọ́n bá rí trace wípé okay, ní inú bí yìí o, a rí kinní kan tó ṣe tóńtóló níbi liver, ṣùgbọ́n scan tí wọ́n ṣe kò show wípé bóyá tumor ni, bóyá fatty liver ni. Kí ni wọ́n sọ? Wọ́n sọ wípé okay, go for CT scan, go for MRI scan. Ìyẹn máa gbé jáde gedegbe. Ṣùgbọ́n tá a bá ti dé hospital, tí wọ́n wá sọ wípé ẹ̀tò ní OPD, ìgbà yẹn ni àwa Yorùbá láti bẹ̀rẹ̀ sí ní mọ grumble, inú ò mọ bí wa sí nọ́ọ̀sì, sí dókítà, wọ́n waste time èèyàn, wọ́n yìí dáyàn lóhùn. Tí wọ́n bá gbé patient kan wọlé, tí wọ́n pe SHO fún emergency, ẹ mọ bínú. Ẹ mọ bínú. Ó tún ti jáde, àwọn dókítà wọn yìí fẹ́ ṣiṣẹ́, wọ́n ó ṣe, we are too aggressive when we go to the hospital. And ọ̀pọ̀ ìgbà, the way we react, ó ló máa ń jẹ́ káwọn nurses kí wọ́n overreact because of our body language. We all have our brain that is receiving message right and left. Eléyìí ó mọ grumble, eléyìí ó show body language, eléyìí ó pòṣé. Eléyìí ó pòṣé. Tá bá wá jókòólẹ̀, wọ́n clack wa. Tó bá jẹ́ pé nǹkan tó wà níta bí ọyàn, bóyá kan rí pé ẹ̀sọ́ sọ̀yàn lọ́yàn. Okay, tó bá jẹ́ pé èèyàn ń wo ọmọ lọ́wọ́ ni, tọ́yàn rẹ̀ wá wú, tó wá so, wọ́n kọ mastitis síbẹ̀. Ṣùgbọ́n tó bá jẹ́ pé ẹni yẹn ò wo mọ́, kò kí ń sọ ọmọ kékeré, kò kí ń ṣe anything, tí ọyàn rẹ̀ wá ṣe bèbèbè tó wá kọ, wọn ò ní sọ pé cancer, wọn kọ query cancer. Wọn query rẹ̀ ni. Ṣùgbọ́n tẹ́ bá dọ́dọ̀ alágbo will not query it. Alágbo will say, cancer lélẹ́yìí. Kí ni cell tó rí tó show rẹ̀ wípé the DNA of the cell is changed? Is it because of the wound? Ìgbà yẹn, wọ́n take swab. Wọ́n ní ká lọ ṣe scan. Wọ́n gba blood yín. Wọ́n check white cell yín. White cell yẹn tó bá ti high tàbí ó low, yóò show wípé infection wà. it is still the nurse duty to be calm under no circumstances. At times, it is difficult to control the brain. When you are stressed, it is difficult to control the brain. And that is one thing that they do in the Western world. No matter how when you say we're pain too, you cannot throw tantrum. Lost with you. In the Western world, you are not allowed to throw tantrum. Torí ẹni tó ń throw tantrum sí èèyàn ló náà, òun náà ní brain. The brain will receive the message. And that is the mistake that dúdú a máa ń ṣe. Ó yẹ kó lè calm down. Ó yẹ kó lè calm down. At times, stress doesn't allow you to calm down. Látọjọ́ tẹ́ ti ń lọ government hospital, any hospital in the Western world, you can never see anybody throwing tantrum. You can never see anybody throwing tantrum. Nítorí tó jẹ́ pé every one of us, ẹlòmíì gan ó ń bọ̀ wá sí hospital, ó múra wá ni. Wọn ò ní dáyàn lóhùn, wọn ò ní ṣègbà, wọn ò ní ṣàwo. Lẹ́yìn yẹn, tẹ́ bá kúrò ní ọ̀dọ̀ doctor, wọ́n wá sọ wípé okay, pain ó wà. Wọ́n fún yín ní oògùn. Pain yẹn ẹ lọ rà á. Wọ́n wá fún yín ní antibiotics tó bá jẹ́ pé ọyún wà ńbẹ̀. Ṣùgbọ́n wọ́n ti take swab. Wọ́n ti take swab. Wọ́n wá sọ pé ẹ padà wá. Another thing that we don't like. Tá bá ti dọ́rùn báyìí, tá bá ti ní ẹ máa lọ, ẹ padà wá. The first thing tá mọ̀ sọ ni wípé wọn ò treat mi, wọ́n ní ká máa lọ, wọ́n ní kí n padà wá. Paracetamol ni wọ́n fún mi, wọ́n kàn fọwọ́ pa, wọ́n mú kinní kan, wọ́n ló di tí test. Àwọn doctor wọn ò mọṣẹ́. Doctor don't do blind treatment. They need to know what they are treating. They don't treat people symptomatically. They need to know. Wọ́n mọ̀ wípé infection wà ńbẹ̀ lóòótọ́. The infection is for the antibiotics. Ṣùgbọ́n ó lè di ní ẹ̀yìn tí result yẹn bá jáde kí wọ́n tún wá change antibiotics yẹn. Inú ó tún máa bí wa again ní Naija. Inú ó tún máa bí wa. Wọ́n jẹ́ ká máa waste owó ìgbà tí wọ́n mọ̀ wípé antibiotics yìí ni yóò lò. Kí ló dé tí wọ́n kọ títí tàkọ́kọ́? It is the antibiotics that the infection is tó wà sensitive to. Tí wọ́n bá ṣe culture and sensitivities tí wọ́n mú níbi ojú kíní wa, wọ́n mú lọ, wọ́n wá wò antibiotics wo òun ló wà resistant sí, antibiotics wo òun ló wà sensitive sí. Èyí tí wọ́n fún yín lákọ̀ọ́kọ́, wọ́n kàn fún yín wípé okay, kò control the infection. Okay, result ti jáde nísìnyìí, wọ́n ti change rẹ̀. Á bínú ni. Á bínú. Èyí tí mo ti wá kọ́ra nǹkan nísìnyìí, kí ni wàá fi ṣe? And from doing that, then we will lose interest in the hospital. We won't have the confidence in the doctor and the nurses. The next thing, you go to the app doctors. How about kẹ́tọ́ mọ̀ nǹkan tó ń ṣẹlẹ̀? Àwọn ó kó ẹ̀ palẹ̀, wọ́n kó everything lé. Tó bá wá bẹ́, á tún padà síbẹ̀. Another thing tá tún máa ń ṣe ni wípé when the result come out, tí wọ́n wá sọ fún wa wípé ọyàn yìí o, á fà á ni kó tó di pé ó ran ìkejì. The first thing tí a kọ́ ṣe ni pé ẹ má jẹ́ wọn fà o. Ìgbà tí wọ́n fà tí ìyá Ṣadé ló kú. Ṣé ẹ mọ stage tí ìyá Ṣadé gbé lọ? Ìgbà tí wọ́n fà tí ẹ̀ ló kú o. Aláàjẹ ìtànkẹ̀ wọ́n máa ń wò ó. Àwọn ni wọ́n wo ti ìyá Lùkóńsà. Bóyá mastitis ó ti ẹni ẹni yẹn ní. Ti ìyá Lùkóńsà tí wọ́n sọ yẹn, bóyá mastitis ló ti ẹ̀ ní. Nígbà tọ́mọ rẹ̀ bímọ tán, tí kinní ìdé tọ́yàn rẹ̀ bẹ́ pẹ̀lẹ́pẹ̀lẹ́, ọ̀dọ̀ Aláàjì Òkè Òsè ni wọ́n gbé lọ. Ó ti ẹ̀ lè jẹ́ pé ordinary mastitis tí ò kí ń ṣe, tí ò ní cancerous cell, tí ò ní anything. Èyí tá a rí níta nìyẹn. tó bá wá jẹ́ pé àárín níta diagnosis rẹ máa ń ṣòro ṣe. Inú ń run mí, wọ́n fún yín lóògùn inú rírun, wọ́n fọwọ́ tẹ ikùn yín tí wọn ò bá palpate any mass, tí wọn ò fọwọ́ kan nǹkan kan rí pé kó le, tí wọn ò pa pọ́ọ̀tì kó máa ṣe bémbém, tí wọn ò rí ascites, wọ́n fún yín lóògùn. Wọ́n wá ní kẹ́ ẹ padà wá. Tá a bá ti ń padà lọlé, òun náà ni àwọn èèyàn ti máa kọ́ wa lóríṣiríṣi, lọ ra pẹpẹmẹ́tì, lọ ra singọ́ọ̀mù, lọ ra tìrẹ́bọ̀, lọ ra súùtì líkò. All those things will now aid peristaltic movement. Then you will be relieved for a while. Meanwhile, something is actually happening in the stomach. Táwọn èèyàn bá complain fún mi, I tell people go to the hospital. Then wọ́n ní nítorí go to the hospital. Ṣùgbọ́n ẹ ràn mí lọ́wọ́, go to the hospital. When I'm telling you go to the hospital, go to better hospital. You will end up there if you don't treat yourself. You will end up there. At the end of the day, at the terminal, at the last stage, hospital náà ni gbogbo wọn padà kú sí. But àwọn kan wọ́n kú sínú ilé. Thank you for reposting it. Thank you. So test, ó máa ń pẹ́ ká tó tètè detect ẹ̀. Tí ò bá ti jẹ́ pé bóyá ó wà níta, tó bá jẹ́ pé inú ni, tí wọ́n wá fún yín lóògùn tí ò lọ, tẹ́ tún wá padà lọ, tí wọ́n wá wo fáìlì yín, tí wọ́n rí i pé kíní yìí yóò mọ̀ ṣe, then wọ́n tún ṣe, wọ́n wá ẹ lọ ṣe scan ibi. Ẹnìkan sọ wípé kí n sọ̀rọ̀ nípa MRI scan. MRI scan is just like a big machine tó jẹ́ pé wọ́n gbéyàn wọnú rẹ̀, and yóò show gbogbo pàtì ibi tó bá yẹ kán show, yóò show blood vessel, yóò dilate gbogbo ẹ̀, yóò show gbogbo sẹ́ẹ̀sì yẹn, bí sẹ́ẹ̀sì yẹn ṣe tóbi tó, bó ṣe kéré tó, yóò show, nítorí tó jẹ́ pé àwọn tí wọ́n ń ṣe, wọ́n ti mọ dédé ibi tó yẹ kí sẹ́ẹ̀lì mọ. MRI scan yẹn ó dàbí ìgbà téèyàn bá gbé ìgò sójú. Ẹ jẹ́ ká sọ pé àwọn tí wọ́n máa ń sọ pé wọ́n máa ń rí ọjọ́ ọ̀la èèyàn, bẹ́ẹ̀ ni MRI scan rí. The same thing, CT scan yóò show gbogbo àwọn kinní yẹn lára yín, yóò show rẹ̀. Ṣùgbọ́n ìgbà tí wọ́n bá ti sọ pé ẹ lọ ṣe scan, the same thing, àwa tá à ń wá ọmọ, tá ní fertility, it didn't have any side effects. Even though if it has side effects, the side effect is not going to be immediately. And that is one thing that we kill ourselves with. Tó bá ní ká lọ ṣe kinní kan, wọ́n mà ní máa pààyàn, wọ́n mà ní máa gbẹ̀yàn lẹ́gẹ̀ẹ́, kò kí ń ṣe nǹkan tó bá gbẹ̀yàn wọnú bẹ̀. Òun náà ni X-ray, ó ní side effects. Ṣùgbọ́n à ń ṣe, èèyàn mélòó ló ti kó cancer níbi X-ray? Because they protect you. They protect you. Tí wọ́n bá sọ wípé ẹ jẹ́ kí n sọ pé bóyá mò ń wá ọmọ nísìnyìí, thank you. Ẹ jẹ́ kí n sọ pé bóyá mò ń wá ọmọ. Wọ́n wá ní kí n lọ sí hospital. Wọ́n wá ní kí n lọ ṣe scan of the uterus. Immediately tí wọ́n bá ti ní kí n ṣe scan of the uterus, tán sọ pé kò sí nǹkan kan, mo ti ṣe gbogbo test tán nù. Wọ́n yẹ ilé ọmọ rẹ̀ wò, wọ́n ní kò sí nǹkan kan. Ṣé ilé ọmọ nìkan òun ló ń jẹ́ kéèyàn orí ọmọ bí ni? Òmò ńkọ́, àní lọ bì kankan mọ́. A lọ ṣe tẹ́ẹ̀sì, wọ́n yẹ ilé ọmọ rẹ̀ wò, wọ́n ní kò sí nǹkan kan bẹ̀. Tó o bá yẹ ilé ọmọ wò lónìí, something might have happened in the next 1 month. It's a lie. I've never seen anybody die in the MRI scan. I've never. Who said it? That is the way we kill ourselves. We listen to wọ́n sọ wípé. I've never seen someone. Òyìnbó, they don't gamble. They don't. Mi rò wípé àwọn òyìnbó máa kanlẹ̀kùn àlìjẹ́nà kan tó wọ̀. They don't gamble. Ẹnu kan tó wà níbẹ̀ ni wípé tí èèyàn bá ní mẹ́tà lára, téèyàn ní irin lára, ó lè ṣọ́ọ̀kì èèyàn. Nítorí ẹ̀ ǹlẹ́ ṣe máa ń fìlì fọ́ọ̀mù ṣé kò sí irin níbi orí yín ṣé ẹ ní implant ṣé ẹ ní nǹkan kan wọ́n ní kẹ́ ẹ bọ́ gbogbo ríǹgì yín kẹ́ ẹ bọ́ chain yín kẹ́ ẹ bọ́ earring kẹ́ ẹ bọ́ anything metal lára yín so that it's not gonna shock you like a magnet. Aside from that, gbogbo nǹkan tí wọ́n mọ̀ wípé tó bá wà lára èèyàn ó lè lead to big complications gbogbo ẹ̀ ni wọ́n ti kọ síbẹ̀. They don't gamble, and that is the reason why I don't gamble. I don't gamble with earth. I don't. What I don't know, I will tell you I don't know it. You can't expect me to know everything. I can't know everything. Lẹ́yìn tá a bá wá ṣe yẹn tán tí wọ́n bá ṣe test yìí nítorí tó jẹ́ pé wọ́n máa ń fi medical terminology kọ́ ó ní ò kí ń jẹ́ kẹ́ ẹ mọ̀ nǹkan tó kọ tí wọ́n kọ. And you know the reason why they use medical terminology. Àwọn tí wọ́n dictate àìsàn yẹn most of the time orúkọ wọn ò ní wọ́n fi ń sí i. Ṣùgbọ́n ní ẹ̀yìn yẹn nítorí kẹ́ ẹ bá lè mọ̀ wípé àìsàn tó ń ṣe alágbájá nìyí. Kẹ́ ẹ bá lè mọ̀ wípé àìsàn tó ń ṣe alágbájá nìyí. Ó ní wọ́n fi máa ń fi medical terminology wọ́n fi máa fi ń kọ́. Wọ́n lè kọ anemia plus wípé kò sí ṣé tán bá sọ pé kò sí ẹ̀jẹ̀ tàbí kán kọ lack of blood no blood ṣé ìyá ọmọ tó gbé lọ́wọ́ ṣé kò ti ní fẹ́ kú. Ẹni wọ́n kọ kinní kan plus which means ó pọ̀ wọ́n fi àmì rọ́pọ̀ nọ́ọ̀sì tó fẹ́ treat tó fẹ́ ṣe management yẹn òun ló mọ̀ infection plus. Ṣùgbọ́n tá bá kọ straight English big infection so many infection orí ẹni tó fẹ́ sanwó orí rẹ̀ yóò mọ̀ kíráàkì. Ṣùgbọ́n nítorí tó jẹ́ pé àwọn terminology yẹn wípé kò yé wa ẹ̀sọ́ àti ẹ̀mọ́ nǹkan tí wọ́n kọ síbẹ̀ wọ́n tún ní ká lọ ṣe tẹ́sì ìdààmú wọn ti pọ̀ jù àwọn òkè òyì wọn ò níwà wọn ò ṣe. Nurses is not meant to níwà. Who is calling me again? Alájà mo wà lórí láìfù. Torí kí nọ́ọ̀sì kó bá lè níwà kan ló ṣe lọ sí hospital. Ó gbọ́dọ̀ show empathy ni. Kó wà committed in what she is doing. At times iṣẹ́ yìí gan kò gbà kéèyàn oníwà. You have to face the reality. You have to face what is happening. You don't need emotion. Because you are crying doesn't mean that I will be crying with you. Wọ́n sọ pé nurses dájú. Because your patient is dying doesn't mean that I should be crying with you. I only need to support. Nurses, doctors, no emotion. You don't treat with emotion. If you treat with emotion, you will mismanage. Ọ̀pọ̀lọpọ̀ patient relative wọ́n believe wípé nítorí tẹ́ ìjòkó calm then I should be calm with you. No. I just need to do what I'm supposed to do. Move from you to another patient, move from you to another patient, move from you to another patient. But by the time I sit down with you, now to be saying, ẹ̀yà ẹ̀pẹ̀lẹ́, Ọlọ́run ó wò, when you know that God is not gonna wò. Àwọn àìsàn kọ̀ọ̀kan wà téèyàn mọ̀ pé Ọlọ́run ò ní wò. But you don't need to speak sarcastically. Oh, they're good or kegbe. And that is the reason why they usually tell patient relative at time, go and stay outside. Especially if they know that it's not coping. She or he, they're not coping. They tell you to go and stay outside. They tell you to go and stay outside. Atuma binu when lé wá síta because they know that your emotion is pulling things down. Okay, tá bá ti wá ṣe test lọ. Tí wọ́n wá padà wá. Tí wọ́n wá sọ fún wa wípé wọ́n rí kinní kan níbi ikùn wa. Wọ́n rí kinní kan níbi ẹ̀dọ̀ wa. wọ́n ní kinní kan níbi kíndìnrín wa á sì ṣe test sí mo mọ̀ wípé kò sówó our government is not helping us enough but ọ̀pọ̀ ìgbà negligence ló ń pa wá kú lọ. I talk about a man tó jẹ́ pé mo ti gbàgbé situation yẹn mo wá sọ fún wọn pé kán lọ sí hospital ìyàwó rẹ̀ wá ṣàlàyé mo ní kí wọ́n lọ I did the little that I could do wọn ò lọ wọ́n gbé lọ ní alágbo ni when he was about to go ni wọ́n wá gbé lọ sí hospital ni màmá rẹ̀ wá ìyàwó wọn wá ń pè mí kíní yẹn kò gbà mọ́ ni kó ṣe kíní kan mọ́ ní mi gbọ́ yín látọjọ́ yìí hospital wo lẹ lọ ẹ wo ẹ ní bínú sí wa ni àti ẹ wá padà lọ sí hospital gbà tí wọ́n sọ pé wọ́n ń wo níbì kan la wá padà lọ ní ìsinyìí owó ń tiẹ̀ wá ní pabambarì mo ní owó tí yóò ní nǹkan ẹ lọ́ọ́ kó fálágbo. Poor diagnosis ló máa ń jẹ́ kí cancer kó di stage 4 cancer mọ́ wa lọ́wọ́. Self-medication. Tá bá ní one symptom and it refuse to go, continue checking. Continue. Another problem we have in Nigeria, belief. Kò sí miracle. Kò sí miracle tó máa ń wo àìsàn. Kò sí pastor tó lè wo àìsàn. Not even one. Not even one. Kò sí ìmáàmù tó lè wo àìsàn àfi tí wọ́n bá egbògi rẹ̀ já àmọ́ wípé wọ́n gbàdúrà sínú omi wọ́n wá gbé fún yàn. It's a lie. It's a lie. Woman kan fẹ́ kú sí orí page mi about few months ago. Kí ni nǹkan tó ṣẹlẹ̀? Ó ní wípé wọ́n gbé voice bàbá Adébóyè kan jáde níbi tí bàbá ti sọ wípé ní ara àwọn followers wọn wípé ó ní cancer of the breast. Wọ́n wá gbé lọ UCH. Wọ́n ṣe mastectomy fún. Lẹ́yìn yẹn nínú àwọn handkerchief tí bàbá ti ṣe wọ́n fi nu kinní yẹn ọyàn yẹn dẹ̀ grow back. Mo ní it's a lie. It's a lie. Obìnrin kan fẹ́ kú sórí page mi. You didn't believe in God. You didn't believe in Jesus. Mo ní a tó sì kúrò lórí page mi. Ẹ kó sì kúrò lórí page mi. Kí ló dé tí wọ́n ṣe mastectomy? Kí wọ́n tó fi handkerchief yẹn nù kó tó ṣẹ̀ wá grow ọyàn mi padà. Irú fàbú wo nìyẹn? For how many days ó ní àwọn ọmọ ògògó fi jáde tí wọ́n sọ wípé àwọn lè ṣe wípé ẹni tó bá lè ṣe gbogbo àwọn bàbá tó ń ṣe miracle yẹn àárí kan jáde kan sọ pé kan gbé wá. Àwọn àgbà yẹn authentic àìsàn religion doesn't cure it. Authentic àìsàn religion doesn't cure it in Nigeria. Only fake àìsàn. Ìyẹn wà nínú nǹkan tó ń fún wa ní late and poor diagnosis. Late and poor diagnosis. Ìdí tó fi dàbí ìgbà tó jẹ́ pé ní Western world wọ́n ń ṣe nǹkan jù wá lọ ó ní wípé àwọn èèyàn wọn kò sí diversional therapy tí wọ́n máa ń ṣe. Àwọn ò kí ń tanra wọn. Ẹ jẹ́ kí n sọ kinní kan fún yín. There was a time bí mo ṣe jókòó yìí I have stomach ulcer confirmed one with gastroscopy. Kíní yìí wá ń dààmú mi. Ẹnìkan wá sọ fún mi wípé ẹnìkan wà tó ń ṣe traditional kíní. Mo wá lọ bẹ̀ ní country mi yìí ni. Ní country mi yìí. Ó wá fún mi ní àwọn oògùn kọ̀ọ̀kan tó jẹ́ pé wọ́n ní kí n fi sómi gbóná bíi powder. But he will tell you everything tí wọ́n lò tí wọ́n fi ṣe. Okay, what I got from nǹkan tó fún mi ni wípé it's very thick. It will now seal. Ó máa seal ojú egbò yẹn. But you know what she told me? Don't stop your medication. don't stop it, we are managing it, you understand better. Mo ní yes. So I was taking my oògùn tí government tí hospital fún mi láàárọ̀, màá mu títí tí ẹ̀yẹn kí n tó lọ sùn, so that if I have acid reflux wípé kò ní bó ojú kinní yẹn. But we are never sincere. We are never sincere. Àwa dúdú. And what we are putting together, we don't even know it. What we are putting together. But so at the end of the day, mo rí bí ìgbà tó jẹ́ pé, okay, this thing is very slamming. I can use ewe or ilá instead of it. And if I wake up in the night and I'm having like a reflux, I will go to my fridge. I always have cold ilá. Then I will drink ilá. Then I will go back to bed. It will seal it. But àwọn èèyàn wa, wọ́n sọ fún, it's only sealing it. It's not stopping my hydrochloric acid from secretion. It's not stopping my hydrochloric acid from secretion. And that is the reason when you come to me, I tell you, I don't know anything about herbs. Tí wọ́n bá wá diagnose wa, Nigeria lónìí, àwọn doctor wa náà ṣe a lot of havoc. Wọ́n ṣe jàǹbá tó pọ̀ fún wa. Nurses ń ṣe jàǹbá tó pọ̀ fún wa. Doctors ń ṣe jàǹbá tó pọ̀ fún wa. Because of love of money, àti like owó jù. Tí wọ́n bá gbé patient wá, tí wọ́n bá rí pé you are nagging too much, it is one of those attendants that will come to you to say, àbí tẹ́ bá wá mọ̀ wípé bóyá kẹ́sì máa lọ kinní tó wà ní ìsàlẹ̀ ọjà, Ìlọrin mo mọ̀ ní o. Bóyá kẹ́sì máa lọ kinní tó wà ní ìsàlẹ̀ ọjà, bóyá kẹ́ máa lọ́dọ̀ Ṣàngó. There was a time, àwọn ọmọ kéékèèké yẹn, they were growing up, and one day one of them rang me to say, ó fìlì lumps. Mo wá ní kó máa lọ General Hospital tó wà ní ọ̀nà Adéwọlé ní Ìlọrin. Kò kí ń ṣe èyí tó wà lókè òyì. Ìgbà tó débẹ̀, ẹni yẹn sọ fún wípé ibì kan wà tí wọ́n ti lè ṣe fún ní Ṣàngó, ṣùgbọ́n àwọn làwọn, mo ní I don't want. Iyó pẹ́ kó tó ṣe, mo ní even though if it is a month. Even though if it is a month. We need to do things with protocol. Protocol yẹn ò like. And because you don't like protocol, people take advantage of your haste. You're still in haste. Then they take advantage of that to refer you to anywhere. Kẹ́ tó mọ̀ nǹkan tó ń ṣẹlẹ̀, àwọn alápàtà ni ó sọ operation fún yín bẹ̀. Àwọn alápàtà. So ọmọ yẹn, mo wá ní kó lọ Adéwọlé. Ó gba káàdì lónìí. Ó rí doctor. Wọ́n ní kó tún padà wá. Nǹkan tó yẹ ká ṣe ní ẹ̀ẹ́rin kínní, a ṣe lẹ́ẹ̀rin ọ̀sẹ̀ mẹ́ta. She's not dying. It's not emergency. But a qualified doctor did it that knows everything about breast. Ìgbà tí wọ́n dẹ̀ ṣe, wọ́n gbé lọ, wọ́n dẹ̀ send the result fún mi. Okay, good luck. But nítorí tó jẹ́ pé tá bá ti dé hospital, tá bá ti rí èrò tó ti pọ̀ báyìí, we continue nagging. We will be annoy everybody. We will annoy ourselves. Kẹ́ tó mọ̀ nǹkan tó ń ṣẹlẹ̀, wọ́n ti wá bá yín, àbí tẹ́ bá wá mọ̀, àwọn doctor tó wà níbí, àwọn náà lọ ní èyí tó wà lókè ọjà. Ó dá, wọ́n kúkú ní doctor kan náà ni. Ṣùgbọ́n tó bá jẹ́ pé teaching hospital ni, another problem tó tún wà ńbẹ̀ ni, is usually senior upon senior. SHO will see you, senior SHO will see you, Reg will see you, senior Reg will see you, consultant will later see you if need be. Tí wọ́n bá dẹ̀ fẹ́ ṣe operation fún yàn, gbogbo àwọn tí mo dárúkọ yìí, gbogbo wọn ni wọ́n pè nínú tíátà. Ẹ wá sọ pé wọ́n mọ̀ fìyàn kọ́ṣẹ́, wọ́n fi ọkọ́ ṣẹ́. Àwọn tí wọ́n lọ ṣe ní private hospital náà, are you sure wípé that quality you want, he has it. He has it. Tí wọ́n bá ti làyàn báyìí, nọ́ọ̀sì ó máa sọ tiẹ̀, dókítà ó máa sọ tiẹ̀, ó máa ń jẹ́ kí ojú tó pọ̀ kó rí nǹkan. Even nǹkan míì wà tó jẹ́ pé wọn ò rí surgeon gangan ò rí, ó lè jẹ́ pé ẹni tó ń mọ̀pù fún surgeon, ẹni tó assist olókàn mọ̀pù ibí lórí pé ibí yìí ó mọ̀ wà gangrenous, yóò call attention doctor síbẹ̀ wípé ẹ wo ibí máa dúdú. Then okay, wọ́n ṣe bí wọ́n tún divert síbí. But private hospital tó sáré lọ, ó yẹ kó wà ń kọlù ní 4 o'clock. Wọ́n ní kó wá sọ operation rẹ ní 2 o'clock. Ó kàn lá gbùrùrùrùrù, ó sì yọ nǹkan tó yẹ kó lọ, kò tí ẹ wo environment. And when you want to do surgery, aside from what you are looking for, you look at the environment. Is there any foreign thing, any new thing? Is there any changes in any of the associate organs? Àwọn foreign, àwọn neighbor organs tó wà lẹ́gbẹ̀ẹ́ rẹ̀. And by the time tí ó tiẹ̀ ṣe auxiliary nurse tó wà níbi iṣẹ́ rẹ̀, olóńkọ́ mọ̀pù ẹ̀ níbí, kìkìní yìí bọbẹ̀ yẹn, kàkìní yìí, wo oògùn yìí. Kò sí ìsíbi tó dàbí teaching hospital, general hospital, even for diagnosis. Nílùú òyìnbó náà, ó máa ń pẹ́ kán tó diagnose èèyàn. Ó máa ń pẹ́. Irọ́ ni àwọn èèyàn máa ń pa tí wọ́n sọ pé tó bá ṣe kinní ni wọ́n ti diagnose ẹ̀. The medicine is the same all over the world. Everything is systematic. Ẹnìkan ò lè wá sí hospital kó sì ṣe gbogbo nǹkan. No. You will do your own. When the result is out, if it is something that I can do, I continue. If it is something that I cannot do, I transfer it to the next person. Tí wọ́n bá treat mi, tí mo bá ṣe, they take it to grand round. Grand round yẹn, ibẹ̀ ni ọpọlọ yóò ti máa pe ọpọlọ rán níṣẹ́. Ibẹ̀ ni gbogbo doctors, ibẹ̀ ni yóò wà, gynecologist, oncologist, orthopedic, ibẹ̀ ni gbogbo wọn tí wọ́n ti debate lórí rẹ̀. Okay, the last time we did it, it was like this. The last time we did it, it was like this. Okay, we've done it again. It is like this. What do you think we are going to do? Everybody will now debate. Different people will now be bringing different research. They will now be bringing different research. People, according to Thomas Joel, said in so 2004, but when it got to 2020, another person did the research. This is the latest research. Okay, I did one in Mata, I did one in General Hospital Maran, I did one in Lut. The last one they did in Lut, this was the condition. Gbogbo àwọn nǹkan tẹ́ ń gbòhun tí ó bá nídìí pé wọ́n open èèyàn up, ó nídìí kí wọ́n yà á, ó ní wọ́n fi ṣe textbook. Ó ní wọ́n fi ṣe textbook. Gbogbo àwọn àwòrán tẹ́ ń rí nínú textbook yẹn, wọn ò fi orí kọ́ ni wọ́n ti yà o. Àwọn nǹkan tí wọ́n ń yà tó jẹ́ pé wọ́n rí bó ti ṣe okay, ó ní wọ́n yà. Okay, what stage is it? Báwo ni wọ́n ṣe dictate stage? Ẹnìkan náà ló fún ní stage 1, ìgbésẹ̀ àkọ́kọ́, ìgbésẹ̀ kejì, ìgbésẹ̀ kẹta, ìgbésẹ̀ kẹrin. Ẹnìkan náà ni yóò mú orúkọ kalẹ̀. And all this is by visualization. Nǹkan tí wọ́n rí, okay, bó ló ṣe ń get worse sí. But when we go to ilé alágbo, kò sí yẹn. Cancer náà ni, I flush it out. How are you gonna flush it? You cannot flush cancer. It's a cell. It's changing the DNA. Kì í ṣe àtàmù. Kì í ṣe kán sọ wípé bóyá omi rú, wọ́n wá fi álọ́ọ̀mù síbẹ̀, ó wá settle sísàlẹ̀ wípé kẹ́ ẹ yọ. No. Part of your body is changing. Part of you is changing. Báyìí ló wà, ó wá di báyìí. How are you going to flush it? Part of you tó yẹ kó ráǹdì bí èyí tó wà lẹ́yìn mi yẹn, ó wá ní ẹsẹ̀, ẹ wò, abnormal cell nìyí. Bó lọ ṣe fẹ́ flush ẹ̀? How are you going to flush it? tí àwọn èèyàn sọ mo ní oògùn yóò flush cancer, you cannot flush it, you can only kill it. And when you're killing it, you kill normal cells with it. Lẹ́yìn yẹn tí wọ́n bá ti fúnyàn ní treatment tó ti pa tó ti reduce ẹ̀, they now do operation láti remove àwọn yìí, àwọn tí wọ́n ya ọwọ́ kàtàkàtà yìí, they will now remove it nítorí tó jẹ́ pé wọ́n ti di kànrànjẹ́gbọ́n nínú àgọ́ ara rẹ̀. Despite the fact pé àwọn eléyìí wà ńbẹ̀, àwọn blue tó wà níbi ẹ̀yìn mi yìí, they are still producing, so they will now remove this and leave this normal cell. Okay, how is herb going to flush it? Ṣé yóò shrink ẹ̀ ni? Tó bá shrink ẹ̀, ṣé yóò jábọ́ fún ara rẹ̀ ni? Wọ́n ò wù tí gbòǹgbò. Wọ́n ò wù báyìí tí gbòǹgbò. Ó ní wọ́n ò wù. Wọ́n sì rán padà. Wọ́n sì máa wẹ̀ ẹ́. Tó bá jẹ́ pé ó yẹ kán gé, wọ́n gé bẹ́ẹ̀. Tó bá mọ̀ wípé táwọn bá gé wípé yóò sí spread séyìí tó kù, wọ́n yọ gbogbo ẹ̀, wọ́n sọnù. Àwọn organs kọ̀ọ̀kan wà nínú ara wa tó jẹ́ wípé wọ́n lè hu ara wọn. Irú liver nísìnyìí, liver lè hu ara rẹ̀. Ṣùgbọ́n during the process pó ń hu ara rẹ̀, olómọ fún wa ní liver cirrhosis. Yeah, it's not that they might, no, they will end up killing when they are killing the abnormal cells, the normal cell will cool with it. It will cool with it. Kò sí bẹ́yàn ṣe fẹ́ pa abnormal cell during chemotherapy tó jẹ́ pé wọn ò ní pa normal cell. And that is the reason why the immunity usually go down. So irú àwọn téèyàn bá ní cancer of the liver máa ń hu ara rẹ̀ padà, yóò try àti regenerate ara rẹ̀, ṣùgbọ́n àsìkò tó ń hu ara rẹ̀ padà yẹn ó máa ń fi scar kalẹ̀. Scar yẹn ó ní kò kí ń jẹ́ kó sí good blood supply tó fi máa ń fún wọn ní liver cirrhosis. And liver cirrhosis is the last stage of liver's problem nínú àgọ́ ara wa. Cancer can cause liver cirrhosis. Liver cirrhosis can cause cancer. That is the reason why we need medical attention. Reason tí wọ́n fi máa ń rí wọn tọ́jú ní ibi dáadáa, àwọn ò kí ń divert treatment wọn. Tẹ́ bá ti sọ fún wọn wípé okay, ẹ̀pà 10 ló yẹ kó wà níbí o, ṣùgbọ́n nísìnyìí ó ti di 8, they listen. Tó bá ti sọ fún wọn wípé okay, báyìí ni 8 yẹn ṣe lè kù 6 tó yẹ kó wà, they will listen to you and they will comply. Wọ́n listen, wọ́n dẹ̀ gbọ́rọ̀. Àwọn gangan wọ́n sì lọ kà níbẹ̀, wọ́n lọ kà á mọ̀. But when we want to Google is, can cancer kill? Nǹkan tó béèrè lọ́wọ́ Google ni Google ó sọ fún ọ. Yóò ní yes. Nǹkan tó bá béèrè lọ́wọ́ Google, ó ní Google máa sọ. Google ó sọ pé yes. Àwọn wọ́n jókòólẹ̀, wọ́n kà nípa rẹ̀. How can I help myself? Àwọn gangan ni wọ́n ti kọ́ help ara wọn. How can I help myself? I will stop smoking. I will do this. I will stop eating this. But àwọn ọmọ sáká ni. Tán bá ti sọ, alọ́dọ̀ aládùúrà, alọ́dọ̀ aláwo. Gbogbo àwọn yìí, gbogbo wa la wà naive of what is happening. And we won't be able to help each other better. And that is the reason. That is when we will live at the traditional, at the medical, then we will go to Orioke. I'm a lomo hantu. I'm a lomo, ẹni tó jókòó sí ibi ìkọ̀kàgọ́gọ́ ni yóò mọ gbé abẹ́ òjìji Olódùmarè. Èmi ò wí ní ti Olúwa pé ó ní ààbò àti ìṣọ́ mi, Olúwa mi, ó ní no, ìyẹn ò lè wo àìsàn. Kò lè wo àìsàn. Nítorí tó jẹ́ pé incantation ẹnìkan ni kò fi wo àìsàn nígbà yẹn. ibi tó yé Dáfídì mọ́ ibẹ̀ ni Dáfídì ṣe mọ́ nígbà yẹn. Tẹ́ bá wo nǹkan tán kọ sínú kùrìsíyù kìí ṣàdúrà. Àsàtàárọ̀ wọ́n sọ fún mi wípé ẹnìkan ó kú toyúntoyún. If at this 2026 téèyàn bá ń kú toyúntoyún, it's negligence. Poor antenatal care. Poor antenatal care ní 2026 kéèyàn ó kú toyúntoyún ká tó gbéyàn dé hospital kéèyàn ó ti kú. Kò sí labour tó máa múyàn lẹ́ẹ̀rin 30 minutes. Kò sí. First stage, second stage lọmọ tó jáde, third stage ní placenta ó jáde, fourth stage kò sí bí first stage ṣe kéré tó yóò lò 4 hours. Èyí ó ti máa feel yẹ. But lọ́dọ̀ wa máa fara mọ́, ó máa ń dùnyàn bẹ́ẹ̀ ni, ó máa ń dùnyàn bẹ́ẹ̀ ni, ó máa ń ṣe ìdí mi máa ń fẹ́ mọ́jú kúrò ń bẹ̀. Ọ̀dọ̀ wa ni mo ti máa ń rí wípé we see it as something that we are very strong when we are not showing that we are having pain. When we are not showing that you are having pain, even though the pain is killing you, you are able to show wípé a ní agbára. No. And that is one thing tí mo rí lọ́dọ̀ àwọn òyìnbó yìí. Tí mo bá fún ọ lógùn, tí oògùn yẹn tó wá pè mí wípé it's not working, wípé the pain is high. Yẹn sọ pé rate here. Out of 10, what can you say? Your pain is 7/10. But during that time, tó ń sọ fún ọ wípé my pain is 7/10. Ẹ máa observe ẹni yẹn psychologically. When you do the diversional therapy, what was the facial appearance? Does she relax? Nítorí tó jẹ́ pé ẹlòmíì fẹ́ kẹ́ fún àwọn ní àwọn oògùn tó jẹ́ pé tẹ́ bá ti fún wọn tán, they will sleep off. And you don't want to give. So ẹlòmíì will exaggerate pain. But this medication, we don't even have it. A ní nílé, but they don't use it. Operation fún yàn tán, ó wá fún ní Difin. Ó wá expect kí Difin yẹn kó control pain. Ó wá ń sọ fún ọ wípé pain wà nínú nǹkan. Ó máa ń ṣe, mo ti fún yín ní gbogbo oògùn, kí ni nǹkan tẹ́ ń fẹ́? No. You're supposed to call the doctor. Doctor needs to review. Ẹsẹ̀ operation tán, ó mu oògùn, ó jẹun tán, ikùn rẹ̀ le. Ó sọ fún ọ pé kùn le. Bẹ́ẹ̀ ló máa ń ṣèyàn. No, bẹ́ẹ̀ kọ́. You supposed to act. Ó lè jẹ́ pé ilé ni. Ó ti lè kẹ́ra jù. Dìde kó rìn. Dìde like someone had cesarean section. The first thing láàárọ̀, the mother-in-law will go there to wake her up. When he kẹ́ra, I said, that is nonsense. Someone is having pain. When he kẹ́ra. Because we are not allowed to interpret pain. Ó máa ń jẹ́ kí misdiagnosis náà kó wà. We are not allowed to interpret pain. Thank you. Tí wọ́n bá wá diagnose cancer, kò yẹ ká lọ ilé oníṣíṣe. The treatment is not in ilé oníṣíṣe. Nobody can flush it. You can only kill the cell, then to remove it. Tẹ́ ẹ bá remove ẹ̀, then yóò tún máa takùn. Tẹ́ bá pa sẹ́ẹ̀lì yẹn, ó dàbí ẹ jẹ́ kí n ṣe, ó dàbí igi ìrókò tó wà lẹ́gbẹ̀ẹ́ ilé wa. Àwú tí gbòǹgbò, ṣùgbọ́n a gé lórí. Ṣùgbọ́n ìtàkùn rẹ̀ wà nínú lẹ́lẹ̀. A ti wọ́ gbogbo ewé orí rẹ̀. A wá dáná sun, ṣùgbọ́n a dáná sun ìtàkùn. Tí òjò bá ti rọ̀, tó fa omi mu, ẹ tún rí pé yóò máa sọ ewé díẹ̀díẹ̀. Exactly bí cancer ṣe máa grow nìyẹn exactly kẹtó mọ nǹkan tó ń ṣẹlẹ̀ yóò tún ti takùn yóò tún ti ìwọ̀nba tó wà nínú blood tó rí good blood supply yẹn yóò tún ti gbalẹ̀ kẹtó mọ nǹkan tó ń ṣẹlẹ̀ yóò tún dìde dúró ní bí ejò àìjẹ wọn wà léèyàn ni èèyàn kọ́ àwọn kan wọ́n sì sọ fún ọ wípé àwọn survive cancer because they did the adequate treatment at the right time then a ti lè dẹ́rù bara wa jù wọ́n ní wọ́n gé ọmú téèyàn bá ti gé èèyàn ó kú wọ́n mà ní kò dáa kán yọ ilé ọmọ èèyàn kódà wọ́n lè gé apá yìí dànù tí ò bá jẹ́ ká gbádùn wọ́n lè gé èyí tó bá kù you manage it tásídẹ́ǹtì bá gé kíláàsì lára àwọn nǹkan tí ò jẹ́ ká rí sí nìyẹn. Then when we are talking about chemotherapy is not something that we have to take slightly. Ìyẹn gangan àwa dúdú ẹ mọ̀ jẹ́ kí n ṣe látàárọ̀ tí mo ti ń sọ̀rọ̀ fún mi ní gift o ya Rasulallah Anabi sallallahu alaihi wasallam. Tí wọ́n bá fẹ́ fún yàn thank you ẹnìkan ní we do o thank you ẹ wo nísìnyí mo ti sọ̀rọ̀ àmì dé ń bára o Mr. Chatwell thank you very much mo really appreciate yín thank you for all your messages everything nígbà tá a lọlé thank you you are a very good in-law really appreciate you thank you. téèyàn bá fẹ́ gba chemotherapy tá a bá gba chemotherapy tán wọ́n fún yàn ní radiotherapy láti pa àwọn cells yẹn ni this need immunity nítorí tó jẹ́ pé yóò pa cells of the body kò ní jẹ́ ká á bì á yàgbẹ́ kò sí àìsàn tí ò ní séèyàn tán á tọ̀ á wà unconscious ẹnu wa ó bẹ̀ yánnayànna irun orí wa yóò já nítorí ẹ̀ ó ní wọ́n ń ṣe fẹ́ tí èèyàn bá ń lọ fún chemotherapy ó ní wọ́n ń ṣe fẹ́ ẹni tí ẹnu rẹ̀ ò bò kó wá dúró tíyàn wọ́n ń fẹ́ kí different people kó wà lọ́dọ̀ èèyàn wọ́n máa ń fẹ́ ẹni tó close mọ́ yàn kó dúró tíyàn nítorí tó jẹ́ pé wọ́n máa ń wà dreadful. Yóò yàgbẹ́ ìgbẹ́ rẹ̀ yóò rùn yóò sì yóò dúdú yóò rù tí yóò kú bí kangoro irun rẹ̀ ó já jákujàku báyìí ẹnu rẹ̀ ó pupa àtẹ́lẹwọ́ rẹ̀ ó dúdú ṣùgbọ́n tí ò bá ti kì í jẹ́ wípé bóyá immunity yìí ò sí bẹ̀ chemotherapy ò kì í sábà ń pààyàn but ó máa mú yàn wà dreadful and that was the reason why they stopped giving to Ogogo. It wasn't that by the time tí wọ́n fi ṣe condition rẹ̀ ò gba chemotherapy mọ́. They don't just treat in the hospital. No. And that is the reason why I said they don't treat with emotion. You cannot put emotion in the front. And that is one of the reasons tí wọ́n fi máa ń sọ pé èèyàn dájú. You don't put emotion. Ẹni tí tó ní pain kò lè máa rúnra kí ìwọ náà kó máa rúnra nítorí tẹ́yin rúnra tí kò rúnra kò mí ní kó dájú. That is the only way he or she can treat you better. That is the only way. Put it up, do the ups, do all the necessary things, explain. Then tó bá jẹ́ stage 1 and stage 2 ni tó bá ṣe operation yẹn tán wọ́n sì máa ní kéèyàn ó máa wá kán máa yẹ̀ wò ṣé ibẹ̀ sàn tó bá jẹ́ pé ìta ni wọ́n máa yẹ̀ wò ṣébẹ̀ sàn ṣé sẹ́ẹ̀lì yẹn ò grow back. Stage 1 and 2 bíi báyìí ni ẹ wò kò ju kínkínní báyìí lọ ó yá tó change báyìí ṣùgbọ́n when we are talking about stage 4 ó ti tó báyìí ọjọ́ tá a ya kíní yìí náà cancer la sọ̀rọ̀ ó ti ṣe cha bí kúrùpá. then tó bá sọ wípé èèyàn wà ní stage 4 ni wípé ó ti dé liver, ó ti dé colon, kidney. Okay, pẹ̀lú kidney yẹn sósì lè ń tọ̀, sósì lè ń yàgbẹ́. Ṣé tí wọ́n bá remove ẹ̀, ṣé kò cover gbogbo ibi colon yẹn? Tí wọ́n bá wá wò tán, tí wọ́n bá rí wípé ó ti occupy more than 80% àwọn organs, wọ́n máa fúnyàn wípé aláàánú ni Ọlọ́run within 6 months. Ẹ jọ̀ọ́ ẹ fún mi ní 1 second. Láti jìnnà, ẹ jọ̀ọ́ bá sílẹ̀kùn fáwọn alájà. Sorry, mo ní àlejò ni. Wípé wọ́n máa wò ó 6 months, 1 year. Tó bá dá 6 months fún yàn, èèyàn yẹn lè lò ju 6 months lọ. Tó bá dá 1 year fún yàn, èèyàn yẹn lè lò ju 1 year lọ. But don't let's deceive you. Òun náà ló sì máa padà pa ẹni yẹn. So when it's not responding at all anymore, that is when they call it palliative treatment. What is the palliative treatment? Palliative treatment is the type of treatment that is given. Kẹ́ni yẹn enjoy títí tí yóò fi kú. Definition of nursing, definition of medicine is to treat ailments, is to prevent ailments, treat psychologically, medically, prevent, and also to give peaceful death. To give peaceful death. Òní palliative wà fún. Lónìí, ó ń bì, ẹ fún lóògùn ebi, tébì yẹn yóò fi suppress. Pain yẹn pọ̀, ẹ fún ní oògùn pain, tí pain yẹn yóò fi lọ. Lónìí kò lè jẹun, ẹ fún ní oògùn tí yóò fi jẹun. Lónìí ó ní indigestion, ẹ fún ní oògùn tí yóò aid digestion. Kò lè yàgbẹ́, ẹ fún ní oògùn tí yóò fi yàgbẹ́. Wọ́n máa tú lára títí tí gbogbo organs yẹn tí yóò fi tán, tí brain yóò fi collapse àti heart. That is palliative. That is last stage, last care. Ọ̀pọ̀ tí mi bá sí ọmọ ògógó gbọ́, ọmọ ògógó ń sọ wípé ó ní guess 1, ó ní wọ́n ti diagnose dádì òun. Ó sì ti more than 16 years. So in Nigeria, we're quick to judge. Immediately tí wọ́n jáde síta, tí wọ́n sọ wípé wọ́n ní wọn ò ní treat ẹ̀, people have started coming out, insulting the doctors. Insulting the doctors. And I'm so happy tẹ́ bá rí èyí tí mo ṣe lónìí, mo sọ fún níbẹ̀ wípé irú my brother Alihamdi TV tó jẹ́ pé àwọn èèyàn bú, mo expect wípé nǹkan tí wọ́n rí yẹn will definitely change his orientation. So kì í ṣe pé tí wọ́n bá sọ pé wọ́n kọ́yàn lọ hospital, ẹ máa gbé bọ̀. No, that will definitely change his orientation. Téèyàn bá wà ní stage 3, tọ́lọ́run bá ló mórí bọ́m̀bẹ̀, àánú ni. But stage 4, ó lè pẹ́ kéèyàn tó kú, but astaghfirullah, òun náà ni yóò padà sí, which means ó ti extend the vital organs, liver, kidney. The last time I saw a lady, she has breast cancer. Àbí ẹnìkan kan ibi yìí. Okay, wọ́n drop ẹ̀ sẹ́nu ọ̀nà ni. Alájà Sàlámì ni máa pè wọ́n. I know that I saw her. Wọ́n drop ẹ̀ sẹ́nu ọ̀nà. Tí wọ́n bá sọ pé stage 4, ó ti dé àwọn vital organs ni. Tí àwọn organs yóò bá sì rí iṣẹ́ ṣe, the body, if they cannot perform their functions, it's not complete. Iṣẹ́ liver, kidney ò ní ṣe. Iṣẹ́ kidney, spleen ò ní ṣe. Gbogbo ibi kọ̀ọ̀kan. Iṣẹ́ heart, No other part can do it. There is a lady ní orí social media yìí, she was saying it. I've said it. It's genetic, environmental, lifestyle, age, infection. But it's more of genetic. It's more of genetic. But you can get rid of it if we listen to our body, we pay attention to our body. Whatever you're eating, even though if you're addicted to it, but it's not giving you peace, take it away. Someone like me, I like tea. I drink tea. I came from the family tó jẹ́ pé when bongo tea was in the 70s, bongo tea la máa mu. So I more like it taste bongo tea yẹn, but I have gastritis. Kódà ordinary lifting tí mo bá mu, inú mi máa lu bàtà. Bẹ́ẹ̀ ni. It is. This is what I'm saying. It's not a sickness from God. I don't know the reason why we are protecting God. Why are we protecting God? Is it likeness? Is it because we like God? If cancer is not from God, if cancer is from Satan, and we believe God is in control of everything, when God is in control of Satan, why does he allow Satan to inflate it? It's nature. It's body chemistry. It's genetic. And that is the reason why a lot of people believe that I'm not a godly person, because I didn't take this word of God in a stupid way. Àwa náà là ń gbàdúrà tá à ń sọ pé Ọlọ́run ní kápá lórí gbogbo ayé. Kí ló dé tó jẹ́ pé èṣù nìkan lọ́lọ́run ò ní kápá lé lórí? Okay, if someone wants to beat your child, you try to defend, you fence. Even ká rí pé ọmọ wa jẹ̀bi, ìyàwó wa jẹ̀bi, ọkọ wa jẹ̀bi, we still go out láti lè sọ pé nígbà tí wọ́n fẹ́ gbé ta ni Ọlọ́run, kí ni ta ni ìyàwó ta ni Ọlọ́run ṣe? Ìyàwó ta ni Ọlọ́run ó wà mọ́ ọkọ rẹ̀ báyìí. Ó wà mọ́ ọkọ rẹ̀ báyìí, kò jẹ́ kí wọ́n rí gbé. Bèlèntè Ọlọ́run tó jẹ́ pé wà á ń sìn. What is this spiritual that we are talking about? Spiritual is all about human being. Spiritual is all about human being. Tó bá ṣe mi ní ń sàsí yín, ẹ̀yin lẹ ń sàsí mi. Then kí ló dé tọ́lọ́run kápá gbogbo nǹkan? Kò pápá èṣù, kò kápá spiritual. No spiritual causes any ailment. It's body. So, èmi wá ní ọjọ́ mi tí mo bá rí lifting, tí mo bá rí tea báyìí, ojú mi máa ràn bí ojú ẹranko. I feel like drinking it. One day I sat myself down. Then I talked to myself, why do I need to be drinking this tea bag? Why do I need to be drinking it? Anytime I drink today, I drink tomorrow. Next tomorrow, my tummy will be yóò máa lu bàtà ni, gbogbo bí yóò máa ta mí. Then I stop myself. It means my body is not tolerating it. My body is not tolerating it. If I refuse to listen, it can change things in my DNA. If I refuse to listen. A lot of us, we cannot listen to our body. We cannot. A lè listen sí àgọ́ ara wa. I'm a medical personnel, nothing like offer. Like this cancer, everybody believe that cancer is offer. It's not. It's not. Tó bá jẹ́ pé offer ni, then ṣé bí wọ́n máa sọ pé ẹ lọ rúbọ, ẹ gbẹ́bọ síbí, ẹ ṣe kinní kan, but it's never healed. It is ailment that happen in our body that you cannot say how it happens. But àwọn tí wọ́n ṣe research, wọ́n jẹ́ ká mọ̀ pé àwọn kan wà tí wọ́n ní BRCA1, BRCA2, MLH1 tó jẹ́ pé people that have this type of things wípé kò ní jẹ́ kí ní àsìkò tó bá yẹ kí sẹ́ẹ̀lì kó kú nínú àgọ́ ara wa kò ní jẹ́ kó kú, yóò jẹ́ kí multiplication nǹkan tó ń jẹ́ kí cells of our body kó kú after 120 days is weak. So inside the cell yẹn kó kú, then multiplication of it, the major thing tó ń cause cancer nìyẹn. Change in the DNA of our cells, mutation. It could then, all other things, it could be drug, olofa, it could be environment. It could be our lifestyle. Ká jí ká mọtí, ká gbé àdìmọ́nu, ká fi sẹ́nu, ká fi ògógóró papọ̀ mọ́ láìmù, ká fi èrù, ginger àti gbogbo oríṣiríṣi nǹkan ká kó papọ̀, ká wá dà mọ́nú ara wọn, ká wá mú. It can change your body chemistry. Ọtí wà nínú nǹkan tó ń change body chemistry. Sìgá wà nínú nǹkan tó ń change body chemistry, that it can cause mutation, sex reaction, change in the DNA of your cells, because you are introducing another chemical into your body. Nicotinic acid, nicotine. Ẹ wo irú àdìmẹ́nu yẹn, wọ́n ní wọ́n fi páàdì kòkó ṣe. Oh, thank you. I don't know how to do it. God who made him. Wàláì. Bóyá tẹ́ bá béèrè, ẹ̀yin èèyàn ẹ bá mi kọ́ àwọn èèyàn wọn láwọn fẹ́ fún mi ní gift, but they didn't know how to do it. Even gan kíní tí wọ́n gbé fún wa tí wọ́n sọ pé àwọn tí wọ́n bá can family planning change the gen? No. Though family planning is also hormone. Nínú àwọn tó ń cause cancer yìí, hormone wà ń bẹ̀. It's either the hormone is low or it's over. But most of the time, the type of hormone tó wà nínú family planning kò lè shoot hormone wa up. Kò dẹ̀ ní diminish it just like that. It's only stopping ovulation. So I won't say family planning can change it. No. Family planning cannot. It's just small hormone when you want forward in family planning. But at times we misuse things. Àwọn ọmọ wa ní ìsinyìí tí wọ́n bá ti ní wọ́n dóko lónìí, wọ́n lo kí ni oògùn tí wọ́n máa ń lò, bí wọ́n tún dó lọ́la wọ́n tún lò, bí wọ́n tún dó lọ́tùnla wọ́n tún lò. Kí ni orúkọ oògùn tí kì í jẹ́ kán lóyún yẹn? Then gbogbo àwọn drug, àwọn àdìmẹ́nu, àwọn oríṣiríṣi àwọn àgbo táǹkì tá ń da àwọn ọtí sí. We need to be careful. If someone has plumbing, the breast and doctor did test and they said no cancer symptom, can they leave it? Lump, don't leave lump. You cannot do, báwo tí èèyàn bá ní lump, báwo ni wọ́n ṣe mọ̀ pé kò ní cancerous cell? You need to remove it to do the biopsy. You need to remove it. That is benign tumor. That is benign tumor. If you see lump in your breast, remove it. Adenoma is different from, àwọn kan wà tán ní thick fibrous tissue tó jẹ́ pé tán bá bu ibi yìí yóò tíìkì. Irú yẹn scan nìkan ló need. Ṣùgbọ́n pé èèyàn ní lump tó jẹ́ pé tó bá mú o lè mú dúró lọ́wọ́ bí mo ti ṣe mú ẹ̀pà yìí, remove it. That is benign. That is benign. Remove it. And that lump is even common nowadays. That lump is very common nowadays. We need to treat yourself. Kò sí anybody tí ò lè ní cancer. Kò sí. Wípé ẹ̀dá kan ló wà tí ò lè ní cancer nílé ayé yìí. It's a lie. It's a lie. Even gan ẹlòmíì ò ní family history. Ẹnìkan ló kàn dé máa bẹ̀rẹ̀ rẹ̀. Then àwa dúdú, how many generations la mọ̀? How many generations? Tí wọ́n bá béèrè wípé ẹlòmíì ìyá rẹ̀ kú nísìnyìí, tán bá sọ pé àìsàn wo ló pa ìyá rẹ̀? Kò sí àìsàn kankan. I reject it in Jesus' name. I reject it in Jesus' name. Àwùsùbìlà ìmínà ṣetán rọ̀jìm. So as a result of that, a lot of us will have high blood pressure, we have diabetes, we have this, we have that. Our children didn't even know. Mi fẹ́ ká yọ ọmọ mi mọ́ já, kódà yín ìjẹ́ kẹ́ni kankan mọ̀. You need to let them know. You need to let them know. Àyà jíjá doesn't kill. Just like that. You need to let them know. So that by the time lọ́jọ́ iwájú tí wọ́n bá ń bèrè lọ́wọ́ rẹ̀ pé any family of hypertension, any family of diabetes, any family of cancer, any family of this, you'll be able to say yes. Then that is going to make them to know, to take a step ahead, to treat you more. When we are sick, we say, I'm strong. You are not strong. You are sick. Ibo láti rí àwọn mentality wa tó jẹ́ pé tí a bá sick tí mo sọ pé tẹ́ pè mí tí mo wá sọ pé ó mọ̀ rẹ̀ mí ni ẹ sì believe pé yóò rẹ̀ mí. Don't say you are sick, say you are strong. Ọlọ́run ò ní jẹ́ ká sick. Èyí tí mo wá níyì nǹkan, who brought it? Èyí tí mo níyì nǹkan, who brought it? When you are sick, tell people you are sick. Not I'm strong. Someone was telling me one story. Tí mo lọ ilé ní èyí, ọmọ ìyá, she has breast problem and she didn't allow anybody to know. Nínú gbogbo ọmọ ìyá rẹ̀, not even one, òun àtọkọ rẹ̀ nìkan, òní wọ́n mọ̀. Títí dé the last stage. Kódà wọ́n lọ hospital, wọ́n lọ operation, ọmọ ìyá rẹ̀ kankan ò mọ̀. Under the umbrella, God will heal me. Ọjọ́ tí wọ́n pè é, àgbọ̀n rẹ̀ náà ni, mo strong ni, mo ibo wá ló ń dùn ọ́. Bí o bá jọmọ ìyá mi tí mo pè ọ́ tó lọ strong, I will not ask of you again. Ó lè dìde lé ọ lọ strong. Ibo láti rí gbogbo àwọn the way we think. The cause of kidney stone, dehydration máa ń fà á. Excessive intake of calcium ó máa ń fà á. Ó depend lórí solution. If it is small, you can drink water. You flush it out. If it is big, you need operation. Kan remove ẹ̀. Irú rẹ̀ náà ṣe fún Ọláìyá Igwe. Irú rẹ̀ náà ṣe fún Ọláìyá. You need the operation to remove it. Ó máa fún yàn ní sharp pain. Hematuria tó jẹ́ pé èyí ó máa tọ̀, èyí ó máa rí blood kéékèèké níbẹ̀ nítorí tó jẹ́ pé at times head rẹ̀ máa ń ṣe ṣàkàṣàkà, so yóò máa crack bó ni wọ́n ń pè kidney yẹn yóò máa ṣe, so ẹ̀jẹ̀ yóò máa yọ. So tí wọ́n bá ṣe scan, if it is small, they tell you to drink ordinary water, not lime and water, just ordinary water. They will tell you, drink this how many liters in 24 hours. Then it will flush it out. But if it is big, then they need to do operation. If your creatinine is high, then that is your kidney is complaining. So it means your kidney is not filtering the way it's supposed to filter. So what you need to do is you go and see àwọn tó ń deal pẹ̀lú kidney. Àwọn tó ń deal pẹ̀lú kidney. Àwọn tí wọ́n diagnose ẹ̀ wípé the creatinine is high, then you go to the clinic. They tell you what to do. They tell you the type of food to eat. Then they do kidney scan to see the level. It may be if there's any damages to the glomerulus. What is the condition of the glomerulus that is making in àwọn substances tó yẹ kó wà filter go into your blood? Creatinine, urea, potassium, gbogbo irú nǹkan bẹ́ẹ̀ yẹn, they will check it. Sodium. So if any of it is high, it means your kidney is complaining. Your kidney is complaining. Okay, ẹ jẹ́ kí n gbé aago mélòó ló lù ń sìn. Oh, we are even to 4. Thank you. Ẹ jẹ́ kí n gbé àwọn èèyàn sókè tá a bá ní ẹni tó ní question ẹ béèrè lọ́wọ́ mi, but mo bẹ̀ yín torí Ọlọ́run anytime tẹ́ bá rí pé mo post anything nípa religion, if you don't like it, just pass it. Okay, the only way you can know that it's side is when you do the urea and electrolytes, but they don't just write urea and electrolytes for you. If there's no problem, it's not something that you need to be doing, except if you're medication, tẹ́ bá wà ní orí diabetes medication, tẹ́ wà lórí hypertensive medication, then you need to be doing your urea and electrolyte at least 4 times in a year, or 4 or 3 times in a year. Causes of gallstone in the bladder. It's not the causes that you need to know. When you have it, go to the hospital. When you have it, go to the hospital. Dehydration lè fà á. Oúnjẹ téèyàn jẹ lè fà á. Go to the hospital. Because once you have it, it's not the causes that you are looking for the treatment. You are looking for the treatment. You are looking for the treatment. And when you have liver problem, it can also cause it. Thank you, thank you. Thank you. Ẹ jẹ́ kí n bá àwọn èèyàn sókè. If people want to ask me question or they have any contribution, SM, thank you, sir. Thank you, sir. Amen. Amen, 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 amen. Amen, 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 amen. Thank you very much. SM. Okay.
The lifestyle.
Okay.
Sherry, àkọ́kọ́ mo discover pé ó kó jọjọ à ń sáré afẹ́ là afẹ́ lu ìwé ìtẹ́lómi ṣe ń gbèsè ayé nípa pé bá ṣe ń jẹ ìwọ̀n bá àsìkò tá a fi ń sùn àwọn nǹkan tá a expose sí ẹ̀wọ̀n sí ẹ̀rí pé gbogbo à ń jẹ natural food ó ti ń dínkù
Bẹ́ẹ̀ni.
ó ti ń di chemical food
Bẹ́ẹ̀ni.
àwọn nǹkan nù ọ̀rá tá a bá ń ṣe oúnjẹ tán wọ́n á pọ́n ewu pátí wọ́n á pọ́n àmàlà ní nylon àwọn nylon yẹn chemical ló wà lórí.
Bẹ́ẹ̀ni, òun náà ni oní lifestyle ìyẹn wà lábẹ́ lifestyle.
Gbogbo èso tá à ń jẹ náà wọ́n fi chemical ṣe.
Bẹ́ẹ̀ni.
Ìlú gan ràn wá lọ́wọ́ torí ẹ̀mí káṣá ṣe ń pọ̀.
Bẹ́ẹ̀ni.
Torí pé àwọn tó yẹ kó máa regulate nǹkan tá à ń jẹ tó yẹ kó máa check ẹ̀ wọ́n sí lójúṣe mọ́.
No.
Ọlọ́run ní kó wá fàánú gbà wá àkọ́kọ́ àwa ni wọ́n lè ran ara náà lọ́wọ́. Èmi wá sọ fáwọn èèyàn pé ṣe rí tí ẹ̀ bá ń ṣe exercise.
Bẹ́ẹ̀ni.
Naturally tó bá yẹ pé 80% àrùn wà lára èèyàn láti ẹ̀kọ́ mú 20 kúrò bẹ́ẹ̀ lọ.
Bẹ́ẹ̀ni.
Torí one tí àtìyàn bá ń ṣiṣẹ́ dáadáa kò ní affect àwọn other part of the body.
Bẹ́ẹ̀ni.
Ẹ̀jẹ̀ náà ni a fi ń jẹ́ èèyàn. Ẹ̀jẹ̀ la fi ń jẹ́ èèyàn tí ò bá sẹ́jẹ̀ lára èèyàn mọ́ èèyàn ò lè sí mọ́.
Bẹ́ẹ̀ni.
So ẹlòmíràn jẹ́ pé ẹ̀jẹ̀ mi wà tí ó yẹ kó wà lára wa nígbà mi tó máa wà lára wa tó máa di toxin sí wa lára. Ó lè jẹ́ pé out of sweat ká sweat out oúnjẹ tá a jẹ tó dàpọ̀ tí wọ́n ń ṣe one or two things tó ń sọ di ẹ̀jẹ̀ sí wa lára. Oúnjẹ yẹn tí ò bá digest tí ò ṣe bó ṣe kó ṣe ṣe á di nǹkan burúkú síyàn lára. Tí o ṣe rí ẹlòmíì àjí làárọ̀ mo máa ń táwọn olùbá tó máa sí feed àwọn dókítà máa recommend fún pé kó wá sí feed kó wá watch weight wọn kó wá keep fit. Máa wẹ̀lú máa ní kí ló dé tẹ́ ẹ fi wúra yín ìrọ̀lẹ́ fi di báyìí. Jẹ́rí mo sọ fún ni mà ààrẹ rẹ̀ torí bẹ́ẹ̀ yẹn sọ náà pé níbo pé kéèyàn fúnyàn ní palliative ẹlòmíì tó bá dé tẹ bá sọ nǹkan tó wà nínú tó ń ṣe fún ó lè gbẹ̀mí mi.
bẹ́ẹ̀ni
So àkọ́kọ́ jẹ́ kí wọ́n ti ẹ̀kọ́kọ́ ní lighter mode náà
bẹ́ẹ̀ni
kọ́kọ́ wọn kọ́kọ́ balẹ̀ torí iṣẹ́ mọ̀ pé àti build nǹkan mọ́mì kò easy wà á ti destroy easy ni.
bẹ́ẹ̀ni
ẹni tó ti hard the weight gbogbo àti tó ń jẹ nǹkan tó ń ṣe gbogbo ẹ̀ ó máa rọ̀ lọ́rùn láti ṣe ṣùgbọ́n tá a bá ní kó shed weight ó máa difficult fún the same thing náà ni pẹ̀lú àrùn tó ń ṣe àwọn èèyàn àrùn wọ ara easily wà á ti lè dà ló difficult.
bẹ́ẹ̀ni
so ní life táwọn èèyàn wá ń gbé anybody tó bá ti àbò 40 years ó yẹ kó máa lọ fún periodical check èmi ẹjẹ fún yín lápẹẹrẹ ẹjẹ fún yín example bá ó má dàbí nínú ọkọ̀ sọ lásán being a sportman mo represent national ní àwọn aspect kan every year la máa ń lọ fún medical check up wọ́n máa check gbogbo gbọdẹ kan check pa wa ó wá dọdún kan ó wá diagnose ti lọ bẹ mẹ́fà sí doctor wa ní mo ní ischemic heart disease
okay
ṣe àwọn pé tó bá sọ fún ẹni tó yẹ pé kò sí ní line wa ó lè stigmatization lè pa ènìyàn.
bẹ́ẹ̀ni
bọ́n bá ti doctor sọ fún mi àjọ engage he explain to me extensively and the stage then sọ nípa cancer náà ni gbogbo àrùn ló ní stages.
bẹ́ẹ̀ni
okay kíní yìí o stage tó wà yìí o ordinarily dání mi ṣe sport òun ṣe nǹkan tó bá bàrà but torí mo ṣe sport a ní láti mójútó ẹlòmíràn dey understand the kan tó pè ní ischemic heart disease. àti doctor sọ fún mi gan mo tún ṣe deep research lórí ẹ̀.
anemia of the heart bọ́dì yín ní ẹ̀jẹ̀ ṣùgbọ́n heart yín gangan fúnra rẹ̀ ẹ̀jẹ̀ ò supply sọ́dọ̀ rẹ̀ despite the fact pé ó ń gbé ẹ̀jẹ̀ jáde.
ẹ ṣe mà náà kí ló dé ń fa nǹkan tá à ń jẹ náà ni.
bẹ́ẹ̀ni
dókítà sọ àwọn kan fún mi báyìí tẹ́mi kan láti máa pàtà ẹnu jẹ́wọ́ pé lóòótọ́ ni àwọn tí mi ń jẹ tẹ́lẹ̀ mo bẹ̀rẹ̀ sí í jẹ ó wá ní tí máa fẹ́ mọ̀ pé mo fẹ́ jẹ́ kékeré lọ oògùn tí màá lò gbọ́ngàn ló ṣe pàtàkì o yóò ṣe gbé sára fáwọn kìíní yẹn ṣé ìbílẹ̀ nígbà tí mo ṣọ́ra fáwọn kìíní yẹn ó lọ natural.
ó máa lọ.
so meanwhile nígbà tó lọ tára tù mí tán mo tún padà sáwọn kìíní yẹn tún padà yọkọ̀ ṣùgbọ́n láti ìgbà yẹn dókítà tó jẹ́ dókítà mi ó ti relocate sí Canada kò sẹ́ni tó kọ́ mi tó jẹ́ pé mi gangan fúnra mi mo máa ń ṣọ́ oúnjẹ mo máa ń ṣọ́ ọ̀pọ̀ oúnjẹ dókítà yẹn wá sọ fún mi and that period tí mo sọ yẹn I was still under 36 or something mo wà dókítà yẹn sọ pé tí ẹ bá pé 30 years ó ń gbogbo ẹ̀rọ mi àwọn check up bí ẹ̀ wá fún mi tí ẹ bá pé 40 years àwọn check up bí ẹ̀ wá fún mi tí ẹ bá pé 50 years àwọn check up ní àwọn òkè rí àwọn èèyàn kan wá táwọn bá tún sọ wọ́n rẹ̀ pé wá ṣe check up wọ́n máa sáà ní àgbà tí nǹkan bá yẹ tó bá tó fẹ́ gbẹ̀ ní èèyàn tán làwọn tó máa ń lo as Nigeria.
bẹ́ẹ̀ni pẹ̀lú ẹ jẹ́ kí n hájú kinní kan pẹ̀lú check up tẹ̀sí yẹn ìgbà gbogbo ni mo máa ń sọ fún àwọn ọkùnrin wa once you are more than 40 years go and be doing PSA specific process specific antigen but instead kí àwọn ọkùnrin wa kán máa lọ sí test yẹn wọ́n máa ní different girlfriend ni wọ́n ní tí mi bá bóbìnrin sùn màá ní prostate màá ní cancer but they suppose to go and be checking those that antigen they will never go and they keep on going and prostate cancer ó ń pọ̀ lọ hospital ju títí tẹ́lẹ̀ lọ.
bẹ́ẹ̀ni mà ẹ ṣe gan mi ṣe rí kọlọ má jẹ kí ṣe rí Nàìjíríà yìí orientation olùkọ́ tẹ̀ ṣe yìí mo sọ fún yín mà pé ó yẹ kí gọ́ọ̀mẹ̀ntì ní that kind of body system tó máa fáwọn èèyàn ní orientation àti counseling ẹ wò bẹ́ẹ̀ ṣe wà yìí mo wọ láìpẹ́ yìí mà àwọn táwọn bíi 234 àbí nǹkan ẹ jẹ́ kó máa sọ̀rọ̀ ọkọ̀ àtòkò ẹ̀rì 1000 ẹ̀rì 2000 ẹ̀rọ ọkùnrin tó máa sọ̀sọ́kùsọ ní ìwà yìí ṣe rí èṣù náà láyé sọ religion lóòótọ́ wọ́n mi máa ń parọ́ fún wa but we are spiritual being àwọn ẹ̀kọ́ fúnra wa tó máa sọ fún ẹ̀kọ́ sí ilé ìdìbò HIV ní tí ó máa wá sí lọ́kàn níbi tí ó pa nìyẹn ìfọ̀ àti ẹ̀ bá ń tọ́jú ẹ̀ gan ìtọ́jú ẹ̀ lè má yọ torí ẹ̀mí kò máa bá sọ̀rọ̀ lábẹ́nu yóò lè jẹ́ pé we are spiritual as well but spirituality wa does not mean that we ká má ṣe nǹkan tó wà physical àwọn tá à ń sáré mà tẹ bá bọ́ sórí track ẹ̀rù ó bá yẹn kẹ́ tó bẹ̀rẹ̀ sí sáré ìwọ́n mẹ́tẹ́ bá bẹ̀rẹ̀ sí sáré ẹ̀rù yẹn á lọ tẹ bá parí yẹn tẹ bá yege ẹ pa òkú kí ló ń ṣe ní ìgbọ̀n nígbà tí mo fẹ́ bẹ̀rẹ̀ torí pé bó ṣe rí náà nìyẹn ẹ̀rù náà tẹ pé tó bá ṣàìsàn àti lọ ilé ìwòsàn ló máa ń bà wọ́n lẹ́rù wọ́n sọ wípé òun fẹ́ lọ gbọ́dọ̀ pé tó bá lọ hospital sí o tó bá ti ka ilé ìfowó tó ka tọ̀ fún ikú dé nìyẹn kẹ́lẹ́ mọ̀ bí a ṣe bú ọ̀ ní orientation irú nǹkan tẹ̀lé ń ṣe fún ẹ̀ máa ṣe mọ̀ tánípéjọba lè wọ́n lè gbà ní níyẹ̀wò láti máa ṣe but irú ẹ̀ sísítẹ̀mù wa tó lè ṣe nǹkan báyìí dà tó lẹ́nu jẹ́ pé nílé oníkálukú wa bá ṣe ń gbọ́ yìí ó yẹ ká máa jẹ́ káwọn ọmọ wa máa mọ̀ lóòótọ́ bẹ́ẹ̀ ṣe sọ so that tọ́mọ bá mọ̀ òbí tó wà lọ́jọ́ alẹ́ àwọn ọmọ ẹ̀wọ̀ gbàtọ́ ọ̀rọ̀ tó sọ̀rọ̀ genotype in fact ọlọ́run ló ti kó most of àwọn ẹlòmíì yọ àwọn tó bí 70s 60s wọ́n kàn fẹ́ra wọn blindly ni ẹ̀wọ̀ bá mi kú ṣe pọ̀ gbà yẹn ilé ni ọgbà tó orientation wà àwọn ọmọ sí ẹ bá tọ́ fọ́mọ mi sí as ní ẹ olùfẹ́ tó bá jẹ́ as ní ẹ olùfẹ́ tó bá jẹ́ àwọn ọmọ yẹn lọ́gbọ́n láti sùkúl lọ́yìn kọ́ wọ́n ti mọ̀ ìtọ́ wọn gbogbo yẹn náà ló ní ṣe pẹ̀lú pé àrùn tó ń ṣẹlẹ̀ tó bá jẹ ilé yìí nǹkan báyìí ló lè bí tó bá jẹ tọ̀ nǹkan báyìí ló lè bí èmi ni mo ń béèrè question abẹ́ nǹkan.
okay.
family planning tó ń sọ mo ní ẹni tó súnmọ́ mi tó jẹ́ pé nìyẹn nígbà tó ṣe bí body system ẹ ṣe ṣe bóyá change yẹn díẹ̀ ni mo sọ pé kó lọ stop ẹ.
bẹ́ẹ̀ni ó máa mú ọ̀pọ̀lọpọ̀ wà dreadful.
ẹlòmíì wà dé pé tó bá gbà tán bí á 3 days lẹ́kọ̀ọ́ máa ṣe menstruation á di 7 days ẹ̀já máa ya. ẹlòmíì wà dé pé kò blood tẹ́lẹ̀ tó bá ṣe tó dáwà táwọn fi dá máa ń oríṣiríṣi nǹkan ló máa fi ń lọ wá ṣe understand tán lè bẹ tẹ́lómi ò lè bẹ lómi sọ wọ́n máa sọ fún wa bí medical kìíní náà ni so wọ́n dẹ̀ bí ilẹ̀ pé nǹkan tá a bá sọ náà èmi fẹ́ I want to learn from you ni mo ṣe ń béèrè bí n tá a bá sọ wọ́n máa ń fún confidence gbà mí ìtàbà láìdíà we tell them go and do the check up even tó bá lọ́dọ̀ doctor náà tó bá rí doctor lójú wá ní kó lọ ṣe test náà ni but from experiences ṣe mọ̀ èèyàn lè at least immediate counseling èèyàn lè fún yàn so pẹ̀lú ẹni yẹn you are telling us that pé ẹ̀dùn ṣe ara mi máa wù nǹkan báyìí yọ sí mi lára ẹ̀ mọ̀ well what I know from experience níbi mọ̀ kí lump wà ṣe ẹ̀ understand ma mo ṣe àwọn kí normal àwọn lump mi wà tẹ́gbẹ́ tó bá ṣẹlẹ̀ tó wá ń pọ̀ sí èèyàn lára we tell them to go to hospital. wọ́n ní wọ́n sọ fún mi ní ìjẹta pé òun lọ bá doctor ní kò sí nǹkan kan pé lump àwọn ọmọ nǹkan tó máa ń emotion make inquiry báwọn ọmọ nǹkan tó máa ń fà wọ́n wá fún antibiotics bí kò lọ lò pèmí mi ìfẹ́ dẹni ẹlẹ́rù ṣé mo pé gbogbo story táwọn èèyàn gbọ́ díṣẹ́ ẹlòmíì ti dílé pé tó máa ti ní lump báyìí ṣé òun ti ní cancer. So mo mọ̀ káwọn most of àwọn obìnrin tó wà online náà ó máa ń dẹ́rù bà wọ́n tó yẹ lẹ́nu pé ẹ bá lọ wo àwọn èso alágbo online àtẹwétegbò èrò ń pọ̀ ń bẹ̀ these days ma torí pé ẹja sàwásọ ẹja kìíní gbáfà ẹja kìíní kan ẹlòmíín tó ń bò mọ́ra kò ní lè sọ tó ti yẹn mà and then ẹ bá dẹ̀ tún hospital náà ok ẹ jẹ́ tó fún yín lápẹẹrẹ mà àwọn medical practitioners wa àwọn tó jẹ́ mo sọ pé tó ń tọ́jú yín lọ Canada nígbà tó ń replace wọn àwọn tẹ́ pé wọ́n ṣe ìwọ̀n ò tí ì lé experience àwọn náà kún hospital jù mo sọ láti sọ mà àwọn náà kún bẹ́ẹ̀ jù ẹlòmíì mo rí ẹni tó yẹ pé wọ́n máa ní kó lọ ṣe test tó yẹ pé wọ́n máa ní kó lọ ṣe test bí i from explanation ẹ ti ní heart problem ní ẹ lọ ṣe test dẹ́ni ẹ bá ṣe wọ́n lè má rí nǹkan kan ó lè jẹ́ pé bí i just little counseling ẹni ẹ need but tí doctor bá ti lè sọ fún pé báyìí ẹni ẹ ó máa gbé sọ́kàn nípò tí ní ìṣòro but from experience lèmi ní anybody tó bá sọ bẹ́ẹ̀ yẹn fún mo máa ń sọ fún wọn kí lẹ̀ ń jẹ kí lẹ̀ ń mu ẹgbẹ́ lómi wọn ò lè mí dáadáa náà máa fi dé feed tí doctor bá ti wá ní kó wá sí feed torí pé breeding àwọn kò ṣe máa jẹ́ pé wọ́n pé àti yóò open ni tí ò bá ti open ẹ̀jẹ̀ ò ní ráyè jáde bó ṣe kó ṣe jáde táwọn ọ̀tọ̀pọ̀ àwọn kí ló ń jẹ́ cholesterol
àwọn plug
ní ọ̀pá mi tẹ́jẹ̀ gbà kọjá ẹ̀jẹ̀ ò ní supply ẹ̀ ní lágbára ẹ̀ ní lókun ó yàtọ̀ sí heart failure ó yàtọ̀ jẹun pé irú yẹn tí yóò bá dẹ̀ tọ́jú ẹ̀ tí ibì kan bá ti bẹ́ nínú àwọn ọbẹ̀ yẹn bóyá ní ẹ̀ ṣiṣẹ́ agbára jù tẹ́jẹ̀ bá ti ń gbàgbé tó yẹ kó gbà jáde ìyẹn ṣe ó ti di big problem.
Stroke.
So àwọn primary wọn yẹn from experiences wa máa ń sọ fáwọn èèyàn but mo believe pé táwọn èèyàn bá fi ṣe òkúnkúndùn pé ìgbé ayé tí màmá gbé ti bá jí làárọ̀ kí n mọ tí ń jẹ kí n ṣe exercise bó ṣe weekend ẹlòmíì stress ló máa ń kà sí exercise mo ń fọṣọ mo ń fabọ mo ń ṣe kíní kan ìyẹn yàtọ̀ sí exercise yìí o ni mo ṣe ní pé question tí mò ń bí yín mà irú àwọn obìnrin tó ń bí wá tó ń sọ̀rọ̀ yẹn mo fẹ́ kẹ́ cancel ẹjọ́ mà mo dábàá báwọn míì náà máa gbọ́ wọ́n máa gbọ́rù nǹkan báyẹn ẹ ṣe gọ́mà.
ẹ jẹ́ ká lọ sẹ́rí gbogbo family planning láyé side effect wọn is either you are bleeding excessively or you don't bleed. Sẹ́rí when we are talking about family planning oríṣi family planning mẹ́ta òun ló wà, taking of tablets, then can introduce foreign body, implant, IUD, tàbí kí wọ́n fún yàn ní Depo-Provera. Nǹkan tó máa ń ṣe ni pé kò tiẹ̀ ní jẹ́ kí endometrium lining kó regenerate, kò ní jẹ́ kí yóò alter hormone yẹn. Sẹ́rí kágbà pé èní ni mo bẹ̀rẹ̀ period 5 days or 3 days tí mo fi máa ń ṣe period. Èní yìí ó jẹ́ Thursday, Friday, Saturday, Sunday, Monday. Tó bá ti di Tuesday, ó ní endometrium lining mi, ó ní yóò ti máa regenerate. Ọjọ́ tí mo bá ti stop, ó ní hypothalamus mi yóò ti send sí gonadotrophic hormone. Tí gonadotrophic hormone yóò ti connect mọ́ pituitary gland. Then pituitary gland will now go into follicle stimulating hormone to tell estrogen that Mariam has stopped bleeding. So you need to secrete and start regenerating the endometrium lining. And what is the function of this generating of the endometrium lining? Is either to be shed as a menses or to prepare for baby's embedment. Ṣùgbọ́n nígbà tí mo bá wá sọ pé okay, mi ń fẹ́ ṣe period, mi ń fẹ́ lóyún, tí wọ́n wá fún mi ní depo oṣù mẹ́ta kò ní jẹ́ kí endometrium lining yẹn kó regenerate. Tí endometrium lining ò bá ti regenerate, it means estrogen is not functioning very well. When estrogen is not functioning the way it's supposed to, when estrogen is being suppressed, then kò ní sí ovulation. Nǹkan tó ń ṣẹlẹ̀ níbẹ̀ yẹn nìyẹn. Okay, ẹ wá jẹ́ kán sọ wípé èmi endometrium lining family planning cannot cause cervical cancer. What causes cervical cancer is HPV. That is the only thing that causes cervical cancer. HPV, human papillovirus. So nǹkan tí yóò wá ṣẹlẹ̀ ni pé tí ẹ rí pé tẹ́ bá ń take tablet, wọn ò kí ń overbleed, wọn ò dẹ̀ kí ń side bleed. Nítorí tó jẹ́ pé nǹkan tí tablet yẹn wà fún ni wípé yóò suppress ovulation yẹn ni, kò ní jẹ́ kí kẹ́ ovulate, ṣùgbọ́n yóò jẹ́ kí estrogen kó ṣe bó ti ṣe yẹ kó ṣe. Under normal circumstances, let's say I'm bleeding every 28 days. My estrogen will start secreting ní ọjọ́ tí mo bá ti parí tàbí ọjọ́ kejì tí mo parí period mi. It will now be there for good 14 days, 13. So within 12, 13, 14 days, another egg ó máa jábọ́. Yóò prepare rẹ̀ follicle yẹn to become matured egg. Then my progesterone, luteinizing hormone, will take over. Yóò jẹ́ kí egg yẹn kó jábọ́. Yóò dẹ̀ slow movement rẹ̀. Kò dẹ̀ ní jẹ́ kí spasm kó wà so that fertilization yóò fi wà tó bá jẹ́ pé èmi pẹ̀lú ọkùnrin ní nǹkan ṣe papọ̀. Ṣùgbọ́n tẹ́ bá ń ṣe tablet, nǹkan tó ń ṣẹlẹ̀ ni pé tablet yẹn will not allow you to ovulate, but yóò regenerate endometrium lining, but you will not ovulate. But when it comes to wípé bóyá èèyàn fi IUD sí, ó máa ń jẹ́ kéèyàn bleed excessively. Why? Nítorí tó jẹ́ pé foreign body ni inside the uterus. So yóò jẹ́ kí spasm kó wà. Ẹnu nǹkan tí foreign body yẹn náà ń ṣe, especially copper T, nǹkan tí copper tó wà ń bẹ̀ ó ń ṣe ni wípé tá bá ní sex ń sìn, tí copper T wà nínú uterus mi, copper tó wà níbẹ̀ yẹn kò ní jẹ́ kí sperm yẹn kó yè. Copper yẹn ni ò ní jẹ́ kí sperm yẹn kó wà alive, but endometrium lining ni yóò regenerate. Nítorí tí foreign body wà ń bẹ̀, yóò jẹ́ kó máa ya. So tí èèyàn bá ń ṣe period téèyàn bá ṣe copper T implant and you're having heavy menstruation, is part of it. Ẹnu kan tí wọ́n kàn máa ṣe ni pé wọ́n máa wò ó. With time, within 6 months, body usually gets used to it, and the bleeding will now reduce to minimal. But when you have depo, you may not even bleed. Tàbí kéèyàn bleed kó ṣe kínkínní because it didn't allow the endometrium lining to regenerate. But when you are taking the tablets that you're supposed to be taking every day, the endometrium regenerate, but it will suppress ovulation. So téèyàn bá ń bleed excessively, tí èèyàn bá ti ní fibroid nínú uterus yẹn, body will get used to it. The period is heavy because of the foreign body inside your uterus. Foreign body yẹn òun ló jẹ́ kó wà heavy. Kódà tẹlòmíì yóò máa ṣe tí clot yóò máa jáde, but within how many months the body will get used to it and you'll regulate it. And if it didn't regulate it, another thing is, during the period that all these things are being introduced to our body, we manifest every sign of pregnancy. Nítorí tó jẹ́ pé hormone tó ń jẹ́ kí a máa bì, òun náà ni wọ́n tún fún wa. And it's not that the one we have in our body stopped. Additional added to prevent, to suppress. Estrogen and progesterone, òun náà ni wọ́n introduce sára wa. So nítorí tó jẹ́ pé we have additional one, yóò mọ̀ fún wa ní a lot of signs and symptoms. I'm a weak, I'm a seleyi, I'm a setitititong, but with time, body will get used to it. But kó tó di time tí body get used to it, èèyàn fẹ́ lè fi ọwọ́ yọ dànù fúnra ara èèyàn. But with time, body will get used to it. Because don't let us deceive ourselves. We need it. Yes, we need it. If not, like yesterday, I saw a lady. Ẹ̀mẹ́rin ló bí ìbejì. Mi ìdẹ̀rọ pọ̀ ju ọmọ 30 years lọ, àtàtì kìíní kan. Wọ́n wá ń donate owó fún. Èmi ò lè donate owó fún ẹni bẹ́ẹ̀. If I can have ọmọ mélòó kí n rò nínú ọkàn mi pé kí n dákẹ́. Okay, you had ọmọ àkọ́kọ́ as single. Ọmọ ẹ̀kejì ìbejì, ọmọ ẹ̀kẹta ìbejì, ọmọ ẹ̀kẹrin ìbejì. Wọ́n wá ń tọrọ owó fún, kò sínú ilé tí ó dúró sí. Èmi ò kí ń ṣe irú oore yẹn. Tó ti bí tàkọ́kọ́ tó bí tẹ̀kejì, you need to do something. We need this family planning. We need this family planning. Àfi tó bá jẹ́ pé a máa bímọ, ṣùgbọ́n tó bá jẹ́ pé family planning ni and you're bleeding, they can use it to control it. When you're doing heavy bleeding, they can use it. But one of the side effects, téèyàn bá ń bleed, òun náà ni nínú téèyàn bá ṣe family planning is heavy bleeding. But body will get used to it and it will be adjusted. Body máa adjust ara its hormone. Body will adjust itself around the hormone. So, and someone was asking me, can the family planning cause cervical cancer? No. Any type of family planning we do, either implant here, it's not staying at the neck of our cervix. It's not staying at the neck of our cervix. The IUD, tí a ń fi sí inú kíní wa, is inside the uterus and it's only preventing embedment. Bí ìgbà téèyàn ní fibroid, kò ní jẹ́ kí copper yẹn kò like sperm ò like ẹ̀. Then if there's anything, ká tiẹ̀ gbà pé fertilization wà, kò ní ríbi tí yóò dúró sí, so yóò wálẹ̀. That is the function. But when we are talking of cervical cancer is as a result of HPV, human papillovirus. It's STD, it's sexual transmitted diseases. It's a virus that we can contact it from the sex, through sex. Ọkùnrin may be a carrier. Obìnrin may also be a carrier. So, tí ọkọ mi bá ní ìsìn, tí wọ́n wá transfer rẹ̀ sọ́dọ̀ mi, my body is supposed to get rid of it with my immunity. But if my immunity is low and my body is not able to get rid of it, what is going to happen? It will sit at the neck of my cervix. It will be eroding it. Before you know what is going on, it will change the DNA of my cervix. It's virus. It will change the DNA of my cervix. And that is the reason why it's good. Every woman, when you're active in sex, I would almost say cervical smear test, pap test, every 2 years. We should be doing it every 2 years. especially tá a bá wà active irú àwa tá a ní ọkọ tó jẹ́ pé ọkọ wa yóò wọlé sí wa lára márùn-ún mẹ́rin lẹ́yìn yẹn ọkọ wa sì ní another sex partner àwa obìnrin gangan a máa ń parọ́ mọ́kùnrin ni àwọn obìnrin gangan ọkùnrin ò ká wọn lẹ́nu and nowadays everybody now know the importance of kéèyàn ṣe skin to skin ó máa ń dùn so now this present generation a ti rí ìbálòpọ̀ bí ìgbà tá à ń jẹran tí obìnrin gan bá ń describe ìbálòpọ̀ nísìnyí bí ìgbà tí wọ́n ń fi búrẹ́dì irun tíì bẹ́ẹ̀ ló ti ṣe rí lágọ̀ọ́ ara wa so now ọ̀pọ̀lọpọ̀ obìnrin à ní different sex partner ọ̀pọ̀lọpọ̀ ọkùnrin the same thing so HPV yìí àti hepatitis B to be sincere with you ó wà rampant so the only thing tó cause cervical cancer fún àwọn obìnrin is HPV when you have cervical cancer ata kankan kọ́ HPV ni kì í ṣe ata kì í ṣe àjẹ́ is HPV human papillomavirus that your body immune system cannot get rid of it and you didn't do pap test to detect it when it's supposed to be detected tó jẹ́ pé okay o tí wọ́n bá rí i pé it's changing the DNA test of your cervical changing the DNA test of the cervix then they need to do colposcopy is like bí ìgbà tán introduce bí iná ṣùgbọ́n kò kí ń ṣe iná tí yóò máa jóyàn wọ́n wá lọ fi jó àwọn sẹ́ẹ̀sì yẹn wọ́n lọ fi jó so CIN1 CIN2 wọ́n jó then wọ́n sì ní ẹnìyẹn yóò wá máa repeat pap test yẹn every 6 months so but if you didn't check and you have it deposited on you and your body cannot get rid of it then it will become cancer so nídìí àti ìtanra wa wípé ẹ jẹ́ kí n rẹ́rìn torí the last time I talk about cervical cancer and some people were saying kò sóbìnrin tí ò kì í ní it's a lie kò sóbìnrin tí ò kì í ní it's an infection why will God put cancer the only cancer tó jẹ́ pé we get from sexual transmitted diseases is cervical cancer and it's from HPV infection and that is the reason why it's good for every one of us to be checking ourselves tí mo bá ṣe tí mo rí wípé okay I have wọ́n sọ pé cervical cells mi is changing then my husband also need test. If you know that you are the type of husband, you are the type of wife that you cannot stay with a one sex partner, use condom. Hepatitis B is very rampant nowadays. Though people are telling me, where did you get it? We got hepatitis B from his STD. Then lẹ́yìn yẹn, bóyá tẹ́ bá ní tèmi náà ní tí fluid wá kanra wá. Okay, it can go. It can be from what about Iju? Iju is more of hormone. Fibroid is more of hormone. Fibroid don't turn to cancer. Iju is more of hormonal. So gbogbo wa náà ló yẹ ká máa ṣe testing. Especially this sex is sweet, but it's causing a lot of havoc nínú àgọ́ ara wa because we are not ready to stay with one sex partner. Àtọkùnrin àtobìnrin. Means of getting money is pẹ̀lú ìbálòpọ̀. Mo ti dá yín lóhùn alájà O2 wípé ìju is more of a hormone. Torí àwọn ọmọ kéékèèké nísìnyí, I won't deceive you, they are having fibroid. Kódà àwọn ọmọ tí wọn ò tí ì bímọ, they are having fibroid. Any other question? Wa alaikum salam wa rahmatullahi wa barakatuh.
Mọ́mí ẹ ṣé Ọlọ́run ràn yín lọ́wọ́ o.
Àmín.
Àrùnsí Ọlọ́run jẹ́ tiyín o.
Àmín.
Àwọn ọmọ yín náà mọ́ bá ní ọlọ́ọ̀bá pàdé o.
Àmín.
Ẹ jọ̀ọ́ pẹ́ṣẹ̀ tèmi fẹ́ béèrè mọ́mí.
Yes,
Ẹ rí mo discover nǹkan kan lára mi tí mo bá ti ń ṣe menstruation. Tẹ́lẹ̀tẹ́lẹ̀ kò kí ń wáyé bẹ́ẹ̀ o.
Okay.
But
láti bí oṣù bíi 4 ní ìsìn nǹkan yẹn ti ń ṣe mí bẹ́ẹ̀ so tó bá kù ọ̀la kí n ṣe menstruation màá kàn ṣàdédé dàmíra wá ṣẹ̀gẹ́sì báyìí màá tẹ̀ fíì nínú ọkọ̀ mi pé bóyá menstruation ni ṣùgbọ́n ìgbà tí mo bá lọ sí bedroom pé kí n fọ ara mi nù kí n lo páàdì màá rí i pé kò ń ṣe menstruation.
Okay.
Ṣẹ̀gẹ́sì báyìí pé omi white ni so omi wàá mọ nǹkan tó kọ́ sí nǹkan yẹn.
Ìyẹn is normal. It's normal. It's okay. Kódà ẹ tún rí wípé tí ẹ bá ti fẹ́ tẹ bá tún ti parí ẹ tún rò pé ẹ ti parí something of such yóò tún wá tó jẹ́ pé yóò tún it's normal. Ṣé ẹ mọ̀ wípé okay uterus wa nìyí ìsun ẹ̀jẹ̀ yìí ó wà ń bẹ̀ tẹ́rẹ́ ó ń ṣe ó ń pile up. So nígbà tí ó bá fẹ́ ṣe kò kí ń ṣe wípé tíkì wà náà kọ́ ni yóò kọ́kọ́ jáde díẹ̀ yóò kọ́kọ́ ṣe tó jẹ́ pé yóò wà watery ìyẹn is normal. Even lẹ́yìn téèyàn bá ṣe tán even gan ọ̀pọ̀lọpọ̀ tí wọ́n máa ń complain mo fẹ́ lọ fọ ẹ̀jẹ̀ mi mo ṣe period mi dúdú. Your period is not meant to be red. It's not meant to be red bí aṣọ ara mi nítorí tó jẹ́ pé immediately tó bá ti kúrò ní ibi endometrium lining mi oxygen ó ti kúrò ń bẹ̀ kó tó di kó débi páàdì rẹ ọ̀pọ̀ ìgbà àwọn kan yóò ti kọ́kọ́ jáde is fibroid máa ń fà á ọ̀pọ̀ ìgbà àwọn kan yóò ti kọ́kọ́ jáde tó jẹ́ pé yóò kéré ṣùgbọ́n kò tí ì ní dé ibi páàdì so tẹ́ bá wo ibi páàdì yín tẹ́ wá rí pé ẹ̀jẹ̀ tó jáde ní ibi píríọ̀dù yín is not as red as this is not kò kí ń ṣe ìdọ̀tí tí àwọn kan sọ wípé ìdọ̀tí inú no kò sí ìdọ̀tí inú ẹ̀jẹ̀ is lack of oxygen kò sí oxygen bẹ́ẹ̀ mọ́ ni is normal. Ẹ rí i pé kágbà ìpẹ́ fẹ́ ṣe píríọ̀dù lónìí tẹ́ bá kọ́kọ́ ṣe tó bá jáde yóò kọ́kọ́ dúdú nígbà tó bá yá tó bá become heavy tó jẹ́ pé kinní yẹn ti ń ya ẹ rí i pé yóò pọ́n because as it's coming from the endometrium lining it's going straight to your pad then you can see it there's still more oxygen in it immediately the oxygen is out of it if you check your pad again yóò dúdú so then tó bá tún ti kù díẹ̀ tó fẹ́ tán ẹ rí i pé yóò dúdú nítorí tó jẹ́ pé tó bá ẹ jẹ́ ká sọ pé blade tọ́ mi níbí nísìnyìí ẹ̀jẹ̀ tó bá kọ́ jáde níbẹ̀ yóò pọ́n but nígbà tó bá yá yóò dúdú èyí tó ti jáde síta nítorí tó jẹ́ pé there's no more oxygen so that is deoxygenated blood so most of the blood tá ń rí ní ibi páàdì wa tá a bá ń ṣe period deoxygenated blood ni blood tó jẹ́ pé oxygen bẹ́ẹ̀ ti jáde ṣùgbọ́n àwọn èèyàn wọ́n sọ wípé ẹ̀jẹ̀ rẹ̀ dọ̀tí no you cannot wash your period because the food you are eating is not going inside your uterus it's going into your tummy and it's going to take about 4 hours kó tó digest so and it's not going to your uterus to go and wash your uterus. Ẹ rí wípé tẹ́ bá kọ́kọ́ bẹ̀rẹ̀ period dúdú kékeré yóò kọ jáde later èyí tó pọ́n yóò jáde nígbà tó bá tún yá dúdú mi yóò tún jáde kò ní bá pó pọ́n kò ní bá pó pink the same thing ẹ̀jẹ̀ ìbímọ tá bá ti ṣe ẹ̀jẹ̀ ìbímọ tó bá ti yá ní òní tá bímọ ẹ̀jẹ̀ tó dà lára wa yóò pọ́n bí aṣọ yìí nígbà tí yóò bá fi di ọ̀túnla yóò ti di pinkish nígbà tí yóò bá fi di ijọ́ 5 yóò ti di brown nítorí tó jẹ́ pé kò sí mọ́ oxygen níbẹ̀ mọ́ nígbà tí yóò bá fi di within 2 weeks 3 weeks yóò ti di black completely so tẹ́ bá wá padà rí wípé ẹ̀jẹ̀ míì wá padà ya lára yín ó pupa then you need to go to the hospital something is happening. Epidural doesn't cause fat. Yeah, thank you. Epidural, people always ask this question all the time. Epidural is just an injection introduced here nítorí kan bá lè pa pain. Tí epidural yóò bá cause any problem, you will get to know within 24 to 48 hours. You will get to know within 24 to 48 hours. And it can only cause problem when you have dural tap. Bóyá ní àsìkò tí wọ́n insert nídìí yẹn ó wá kan blood ó kan nerve so ó wá tap rẹ̀ ẹ wá rí traces of blood ẹ rí i pé anesthetic yẹn ó máa yọ kúrò ńbẹ̀ immediately wọ́n dẹ̀ kọ síbẹ̀ wípé Duratap tí wọ́n bá kọ síbẹ̀ pé èèyàn ní Duratap the worst you can have is to have headache within 24 to 48 hours tó jẹ́ pé téèyàn bá dìde dúró báyìí èèyàn ò ní lè dìde dúró orí ò mọ̀ fọ́yàn then nǹkan tí wọ́n máa sábà ń ṣe ni pé kéèyàn ó mú caffeine tàbí kí wọ́n ṣe Durapatch fún yàn tí wọ́n bá ṣe Durapatch ó ti tán nìyẹn. If you're having back pain after that, we are meant to have back pain. No, it's not the epidural. We are meant to have back pain. Even pregnancy, ó máa ń jẹ́ kéèyàn ó ní back pain because of the lordosis. Ṣé mọ̀ ní pé lordosis ni pé kí ẹ̀yìn èèyàn kó tẹ̀ sínú báyìí. Then when we are growing older, anything from age of 30 something, they are going to be degenerative níbi ẹ̀yìn wa. And most of the time we use our back in anything we are doing. As I'm sitting down, I use my back. When you want to carry load, you use your back. When you want to bend down, you use your back. Anything you are doing, even though you use your back. So before you know what is going on, the T2, T3, L4, L5, cartilages ibẹ̀ wọ́n máa ń rin ara wọn tó jẹ́ pé degenerative yóò ti máa ṣẹlẹ̀, and before you know what is going on wọ́n máa rub ara wọn and you'll be having pain. You'll be having pain. But àwọn èèyàn wa tá a bá ti lè gba epidural kan wọ́n nítorí tí mo gba epidural wípé àwọn tí wọn ò gba epidural tí wọ́n ní back pain kọ́. Side effect of epidural is headache, and you will get to know it within 24 to 48 hours. Then they will tell you to take caffeine, and after the caffeine, if you didn't go, they give you Durapatch. Durapatch, they will take blood. Lára yín bí 20 ml of blood maybe. Then they will introduce it to that site. Then it will go. Durapatch. So if you have epidural about 4 years ago and you're still having back pain, it's not epidural. It's not epidural. Epidural is meant to block pain. It's not to give you pain. Okay. So ẹnìkan sọ pé I've been battling back pain before epidural and it doesn't change. It won't change because we make use of our back in anything we are doing. We carry baby, we bend down, we cook, we wash, we walk, we sit, and the type of job we are doing. A lot of people work. Thank you. A lot of people work. When we are working, then posture. Tebari, bí mo ṣe jókòó látàárọ̀, I make sure that I'm sitting upright. Kágbà pé báyìí ni mo ṣe jókòó láti ìgbà tí mo ti ṣe ẹ̀yìn tí mo máa dùn mí. Ẹ rí wípé I sit upright. Posture wa ó matter in this when we are talking of back pain. When we are talking of back pain, our posture matter. Ẹlòmíì tó bá dúró báyìí yóò dá gbogbo ara kalẹ̀, yóò na ẹsẹ̀. So gbogbo pressure yóò wà. You have to stand straight. Good posture like this. So that you are not going to put all your weight on your back. Yeah, bad mattresses, bad chair. Another question? Nearly time for us to go. I started like around 1 o'clock. Okay, but you 3 hours. 2 minutes to make it 3 hours. Any other questions? Ẹ jọ̀ọ́. Okay.
Really enjoy program yẹn gan.
No main food that causes cancer. No main food. Amen.
So question mi lọ báyìí ni pé ìsàlẹ̀ inú máa ń gùn lọ séèyàn bá jókòó bá inú yẹn máa gùn ọ máa kọ mí ní ìsàlẹ̀ inú mi gbọgbọgbọgbọ bẹ́ẹ̀ kì í ṣe pé inú máa rún mí understand bẹ́ẹ̀. So mo ti lọ sí hospital so mo dẹ̀ ti so wọ́n ti treat mi. So
nothing can stop back pain permanently.
So wọ́n ti treat mi so mo dẹ̀ ti ṣe àwọn nǹkan tó bẹ́ẹ̀ yẹ kí n ṣe so wọ́n dẹ̀ ti fún mi láwọn oògùn wọ́n tún fún mi lóògùn kan náà gbà yẹn bíi antibiotics ni wọ́n ní antibiotics ó máa ń lágbára gan mi mọ antibiotics ni so antibiotics yẹn ṣàgbára gan so ìgbà tó fún mi kíní yẹn kò tún wá lọ dáadáa ó sì ń ṣe mí so wọ́n ṣàní kí lọ yà sábọ̀ mi wàá mọ orúkọ kíní sáà yẹn ni mo fi sí wọn so wọ́n ṣàní pé kò sí anything so ìgbà tí mo tún wá padà lọ sọ́dọ̀ dókítà yẹn pé kíní yẹn ṣì ń ṣe mí so wọ́n wá fún mi ní abẹ́rẹ́ kan wọ́n ní abẹ́rẹ́ yẹn wọ́n máa ń fún àwọn tẹ́kọ̀ tó bá ti sọ patient fún yẹn gbà abẹ́rẹ́ ó ṣáà wíìkì tẹ́ pé ò ní mọ nǹkan tó bá fihàn lábẹ́rẹ́ yẹn gbogbo ara èèyàn máa wíìkì èèyàn nílé dìde ara èèyàn gbogbo ara èèyàn ṣáà máa kú sábẹ́ yẹn bíi pé téèyàn bá dìde òní lè gbé yàn dànù ní ìmọ̀rú abẹ́rẹ́ yẹn bọ̀ wọ́n ṣáà máa ń fún àwọn tó máa ń ṣe operation fún yẹn.
Thank you. Tí ó bá jẹ́ pé ìsàlẹ̀ ẹkùn ordinary pé ìsàlẹ̀ ẹkùn kànyàn ni I don't think it should involve any abẹ́rẹ́ because if they give you abẹ́rẹ́ and you cannot stand up it means opiate ni wọ́n fún yàn yẹn so it's I get pé there is something that is causing that ìsàlẹ̀ ẹkùn kànyàn there is something that is causing it under normal circumstances ìsàlẹ̀ ẹkùn máa ń kan obìnrin when we're ovulating when we're ovulating when we're about to menstruate when we finish our menstruation ìsàlẹ̀ ẹkùn máa ń fàyàn so báyìí because of hormone.
But máa jókòó báyìí ó máa fà mí tí máa jókòó bá gbé yàtọ̀ kàdà bá ṣe tí kíní yẹn bá ń ṣe mí lọ́wọ́ so kíní yẹn máa ń ṣe mí so abẹ́rẹ́ níbi tó fún mi dé mi sick gan nígbà tí mo lọ gba treatment mo á sick tó yẹ pé nígbà tí mo gba àwọn treatment mi lè dìde for 4 days mi lè anything kan ẹni tó yẹ pé ó weak mi gan like kó tó di pé wọ́n fún mi ní abẹ́rẹ́ ilé ìtọ́kùnrin yẹn ni mi ò lè ṣe ẹni tó wá weak yẹn bíi pé èèyàn ti sick tẹ́lẹ̀ bí pé ó kàn ti ṣe yàn.
They are treating you for something is causing that inú kíkan so many things can cause it you need to know what they are treating you for so this is the problem when they are treating you need to know your diagnosis and you need to know the name of the medication you are getting. We are in advanced age either you are in Nigeria you are in Ghana you are in the Western world anybody treating you should let you know what your diagnosis is. Abẹ́rẹ́ tán fẹ́ fún yín yìí kí ni àìsàn tí wọ́n ń treat yín fún kì í ṣe pé dókítà ní màá gba abẹ́rẹ́.
Ìyẹn náà ló máa ṣiṣẹ́ pé nǹkan tó ń ṣe níyẹn náà ni wọ́n ṣe ń fún.
Rárá o kí nǹkan tó ń ṣe yín yẹn ní tó ń fa inú kíkan yẹn ẹni ìdí àti mọ nǹkan tó ń fa inú kíkan kí ni wọ́n diagnose inú kíkan is a sign it's not a disease inú tó ń fa yín so yẹn sign ni kí ni nǹkan tó wà níbẹ̀ tó fi ń fa yín. You need to know. Kí ni nǹkan tó wà níbẹ̀ tí inú fi ń fà yín? Under normal circumstances, tí ò bá sí àìsàn níbẹ̀, kò yẹ kí inú kó fàyàn so. Tó bá tiẹ̀ fàyàn so, nǹkan tó lè jẹ́ kó fàyàn so nìyẹn. But if it now persists to the extent of treating it and giving you strong painkiller, you need to know what they diagnose you for. That is one of the reasons why they detect cancer in stage 4. Treating people symptomatically. Someone was asking me a question here. Wípé wọ́n ní kéèyàn má jẹ búrẹ́dì, wọ́n ní kéèyàn má jẹ noodles. Do you know what? The people in Nigeria don't know that. Do you know what? I don't listen to people. Even the rice we are eating, ẹ wo bí rice ṣe pọ̀ lónìí, ta ló mọ nǹkan tó fi ń ṣe rice? Most àwọn noodles tá ń jẹ ẹ̀gẹ́ náà fi ń ṣe. Mo rí ibi tí wọ́n ti ń ṣe. So kí ni ìyàtọ̀ ẹni tó ń jẹ noodles àtẹni tó ń mu gàrí? Kí ni ìyàtọ̀ ẹni tó ń jẹ noodles àti ẹni tó ń jẹ spaghetti? Then bready. Why would they tell you not to eat bread? Wọ́n ní ká má jẹ bread ṣùgbọ́n ń jẹ puff puff. Wọ́n ní ká má jẹ bread ṣùgbọ́n ń jẹ donut. Wọ́n ní ká má jẹ bread ṣùgbọ́n ń jẹ buns. What is the difference? Flour ni wọ́n fi ṣe. Flour ni wọ́n fi ṣe. And I don't know people's problem with this bread. Ẹ má jẹ bread ẹ lè jẹ léyìí ẹni tó jẹ bread àtẹni tó jẹ iṣu. The same thing lájọ jẹ. The only thing kò sí ju wípé àwọn nǹkan kọ̀ọ̀kan tí wọ́n add sí inú bread that make it artificial. yeast wà ńbẹ̀, butter wà ńbẹ̀, saccharin wà ńbẹ̀, milk wà ńbẹ̀, lóríṣiríṣi bẹ́ẹ̀ yẹn. Kí ni nǹkan tí bread lè fún wa? The only thing tí bread lè fún wa kò sí ju constipation lọ. Bread doesn't cause cancer. I have a cancer patient ní Naija. Kó tó di pé mo dé ilé, wọ́n ti fẹ́ pa woman yẹn. Ó ṣe operation tán. Kò sí nǹkan tí wọ́n ní kí màmá yẹn má jẹ. Ẹ lè jẹ iṣu, ẹ lè jẹ sẹ̀mó, ẹ̀fọ́ nìkan ni kẹ́ ẹ máa jẹ. Ẹ máa jẹ̀fọ́, ẹ lè jẹ ilé yìí. By the time tí mo délé, she look emaciated somehow. Fruit nìkan lẹ lè jẹ. So when I got home, the nurse told me, I said, okay, if you don't eat iyán, you don't eat rice, where will you get energy? Fruit cannot give you energy. Function of carbohydrates in our body is to give us energy. And all the food we are eating will be converted into glucose before digestion, before food digestion. Gbogbo ẹran, fatty, protein, end product of it is glucose for good absorption in the body, even the fat. Anything we're eating, all we need to do is we need to eat in a minimal way. Minimal. We need to eat in a minimal way. Bread náà ni ẹlòmíì tó bá gbé bread lọ́ngì yóò jẹ tán, kó bá lè rí jẹ tán yóò kọ́kọ́ papọ̀ báyìí. Mélòó ni bẹ́ẹ̀ n ò káyé tí ń bẹ́ẹ̀. You are not meant to eat more than 2 or 3 slices. Tán bá ní ká má jẹ bread, kí la fẹ́ jẹ? Bread ni oúnjẹ tó easy jù tẹ́bi bá ń pààyàn. Mi rí research débẹ̀ yẹn. Mo gbọ́ lóòótọ́ tí àwọn kan sọ wípé wọ́n ní noodles kan ó ń cause cancer. I don't listen to all those things. I don't listen to all those things. Àwọn kan wọ́n sọ pé ẹ má fi ṣúgà sẹ́kọ̀ọ́ fáwọn ọmọ, ẹ má fún wọn ní biscuit. Ìgbà wo ni wọ́n fẹ́ jẹ? They need sugar. Children need sugar more than we the adults because they burn it. Wọ́n máa ń ṣeré pa. They need sugar to do this ṣeré pa. They need sugar for the good development of the brain. Ẹlòmíì ẹ ní fi sugar sẹ́kọ̀ọ́. Àwọn kan tó ní ká má fi milk sẹ́kọ̀ọ́. Ẹ ní jẹ́ kó ọmọ jẹ biscuit. Ìgbà wo ni wọ́n fẹ́ jẹ? Then kí ló fẹ́ fún wọn ní good development in their brain? Brain needs sugar. Ẹlòmíì tá bá kó oúnjẹ papọ̀ báyìí, ẹ̀rù wọn máa bà yín ni. Yeast ní ká ẹ máa jẹ, wọ́n ní ká ẹ jẹ léyìí, wọ́n ní ká ẹ jẹ léyìí. We need good food. We need all the food. Even though if you have diabetes, you still need all this food. You only need it in a minimal proportion. Okay, ẹ̀pà tí mo gbé wá orí bí ni. Bóyá mo bùtà àkọ́kọ́, mo bùtà kejì. I stop eating. Kò kí n ṣe wípé, okay, it's good to eat ẹ̀pà, then I eat something that is up to this. No. In anything you are eating, you are not supposed to take excess. Even this water, tẹ́ bá mu omi jù, you will have low sodium. Kẹ́ mu omi kọjá bó ṣe yẹ kẹ́ mu, you will have low sodium. Ọ̀gẹ̀dẹ̀, everything is minimal. But àwa àti lè dẹ́rù bara wa jù. Don't eat this, don't eat this, don't eat egg, don't eat meat. One day, one of my sisters was telling me, wọ́n ní ẹni tó bá lá hypertension kì í jẹran. Mo wá béèrè, how many meat are you eating? Ṣé àwọn ẹran tí wọ́n ń gé kéékèèké ní ọjà àpáta wọn tó jẹ́ pé òkèlè wa gan ó wúwo ju ẹran kan lọ, so ni wọ́n ń kà ní ẹran. And we will be depriving ourselves from doing the little enjoyment. And that is the reason why we so much believe in heaven. We so much believe in heaven. Eat everything, but in a minimal way. Anything you cannot eat, your doctor will tell you, not your neighbor. Not your neighbor.
Yeah.
Another question?
wọ́n fún mi ní bí painkiller náà ní ṣábẹ́ fún mo kà nǹkan tó wà lára ẹ̀ mo ti gbàgbé orúkọ ẹ̀ bí painkiller ní so ìgbà tí mo wá rí pé painkiller ní pé wọ́n ní nígbà tí mo ti sọ pé kò fún nǹkan tí wọ́n fẹ́ ṣe sí mọ́ bẹ́ẹ̀ so nǹkan tó wá bá mi lẹ́rù wípé antibiotics tí mo wá lò yẹn so mo ní ẹ̀mọ̀ tí èèyàn bá dókítà kan sọ pé tí èèyàn bá ń plan fún oyún pé tí èèyàn bá lo àwọn oògùn tó yẹ kí èèyàn lò bí àwọn antibiotics àwọn oògùn bẹ́ẹ̀ yẹn pé èèyàn gbọ́dọ̀ try fún pé èèyàn fẹ́ lóyún like ó di after 3 months èèyàn ṣì lè wá try fún ìfẹ́ lóyún.
Okay.
Kéèyàn náà láti protect ọmọ yẹn pé kí kankan má lọ ṣe bẹ́ẹ̀ ṣàkóso mo ti wá ní oyún bẹ́ẹ̀ something like that so mo wá ní ṣé kinní yẹn ṣe kò ní cause anything bẹ́ẹ̀ yẹn pé àwọn oògùn tó lè lò.
Nǹkan tó ṣẹlẹ̀ tí when you are pregnant you are not supposed to take any medication except folic acid. It's not because of anything. It's because of that is formative stage.
Before kí tó lóyún mo ti lo àwọn antibiotics yẹn bó ti lọ síbi like go to 2 months but kò tí pé 3 months.
Kò mean anything. Any antibiotic will leave your body. Immediately you stop taking it. Nígbà tí o kì í ṣe chemo. Tí o kì í ṣe chemo. Antibiotics leave your body. I don't know the name of the antibiotic. And that is the reason why I say you need to know what they are treating you for. You need to know what they are treating you for. You need to know. Please, ma, when are you doing the seminar, ma? I don't know. I haven't fixed date, but I will fix. Nítorí tó jẹ́ pé àwọn kan náà invite me fún talk though mi tí ẹ ti accept wọn. Àwọn kan invite me fún talk. So mo fẹ́ parí títí wọn then I will fix date.
So mo ní nǹkan ọ̀rẹ́ mi kan sọ ẹni yẹn ó ti rọbí fún like 3 days bẹ́yẹn 3 days ló fi rọbí kó tó di pé wọ́n ẹ̀ṣẹ̀ wá tún lọ ṣe operation kò gbà tó máa fi ṣe operation kò wá sí ọmọ mọ́. Ó dẹ̀ fún 3 days. Mo á rò pé bóyá ilé ọgbà tó ti ń rọbí rẹ̀ fún ìgbà ilé yàtọ̀ ti lọ plate fún nǹkan bẹ́yẹn pé ó possible kó máa ṣẹlẹ̀ ṣó possible mà.
Tó ti ń ṣe kí ni?
Ó ti rọbí fún 3 days tí ò rọmọ yẹn bí. Kò dẹ̀ sí wọn tó ṣọmọ gbà tí kó tó di pé bóyá ó rọbí tó wá rọbí fún 3 days. No, wọ́n wá rí ìpàdé lọ síbòmí. Because wọ́n tàn aṣọ operation, wọ́n wá létà aṣọ operation fún. So ní after 3 days yẹn, so àdéhùn ìdè kò sí ọmọ mọ́.
Prolonged labour. Pé nítorí tó rọbí fún ọjọ́ mẹ́ta yẹn náà ni. You are not supposed to rọbí for more than 24 hours. 12 to 24 hours. Ó pẹ́ ju àrírú ẹ̀ rí. Alákọ̀ọ́bí èèyàn máa ní prolonged labour within 12 hours. Tí ò bá ti kì í ṣe alákọ̀ọ́bí within 12 to 24 hours. So wọn ò tiẹ̀ even to 16 hours ni tó bá fi wá rọbí fún ọjọ́ mẹ́ta ọmọ yẹn yóò ti yàgbẹ́ níkùn. Ó ti máa yàgbẹ́ asphyxia àti máa setting. So prolonged labour ló fà á. So the next time tó bá fi rọbí fún ọjọ́ mẹ́ta tí ò rí ọmọ bí it's either kò ní cephalopevic disproportion. Something is happening. It's either the baby is bigger than the pelvis or the presentation is not encouraging. So another time, she doesn't need to labor for ọjọ́ mẹ́ta. No, within 24 hours, if the baby didn't come out, 16 hours again, if the baby didn't come out, go for cesarean section. No mọ̀ fún yín lóríṣiríṣi, Ọlọ́run ò ní jẹ́ ká ṣe iṣẹ́ abẹ. What is in iṣẹ́ abẹ? Open, take the baby out, close. It's not big deal. So it could be a baby could be from asphyxia, meconium aspiration, and brain ọmọ yẹn gan yóò ti pò papọ̀ báyìí. So tó bá bí gan kò wúlò. Yóò ti collapse.
Tó wà Nàìjíríà báyìí folic acid yẹn kò ní ní àwọn èèyàn bọ̀ orí nílò Nàìjíríà nígbà tí mo fẹ́ ra ọdún sí pharmacy yẹn tí mò ń dé wọn ya pharmacy yẹn gan wọ́n sọ pé ṣé 4 milligram wà nígbà tí mo sọ tó ní 5 ló wà tó bí tó ń rí mo máa ń họ́dà ẹ̀ wá gan ní tó ní 4 milligram yẹn títí pé ìgbà tẹ́ pé dọ́tọ̀ láì bẹ̀rẹ̀ sí mi pé.
5 milligram lẹ nídìí nínú oyún. You need 5 milligram.
I need it.
You need 5 milligram during pregnancy. Àwọn tí wọ́n ń tà ní orí igbá ní irú bíi òní 4 milligram But to buy 5 milligram, you need prescription. 5 milligram is the normal dose for folic acid.
Julia, ó máa ń ṣàṣì gan nínú òwe Òṣogbo tí mo wà yìí nítorí ó máa ń pẹ́ àwọn pharmacy gan mi gan ò ní ìbùbọn tí ìbùbọn mi ò tó bẹ́ẹ̀ wọ́n fún yàn gan bẹ́ẹ̀.
During our own time, folic acid ní oní nǹkan tó pọ̀ jù ní Nàìjíríà. You can buy it anywhere. Folic acid. Folic acid. Folic acid ní nǹkan tó pọ̀ jù. I think it's mẹ́wàá is for 10 naira nígbà yẹn bí 10 kobo ni. I don't. So folic acid is still wà ní Naija because the last time I went I still bought. Okay. Any other question from anybody? Bá a ṣe pẹ́ tó, people don't even remember to power tap for me. Kódà power tapping wa kò wọ 50. Same blood when you are pregnant. How many months? Abortion. It could be either abortion or APH. So many things can cause it. Low progesterone can cause it. What is your question? You can't be pregnant for 2 weeks, so you are not pregnant. You can't be pregnant for 2 weeks. You can only be pregnant for 6 weeks. No 2 weeks pregnancy. No 2 weeks. Kò tó lè sọ pé you are pregnant. Ká gbà pé ó yẹ kí n ṣe period ní òní ní 27. Ká gbà pé ó yẹ kí n ṣe period lónìí mi wá ṣe period. Okay, lẹ́yìn ìyẹn òní màá tó máa ronú nípa wípé ṣé mo lóyún ni. So ṣùgbọ́n ọ̀pọ̀lọpọ̀ mo tí ní dúró de ìgbà tó yẹ kí wọ́n ṣe period tí wọ́n fẹ́ máa manifest sign pregnancy. That is psychology. You are not pregnant. So lẹ́yìn yẹn a week after yẹn màá lọ ṣe pregnancy test. Ó ti make it 5 weeks bẹ́ẹ̀ yẹn. Then tó bá di 6 weeks téèyàn bá ṣe scan yóò pick fetal heart if there is pregnancy there. Any pregnancy 6 weeks. Ṣùgbọ́n kò sọ pé you are pregnant for 2 weeks. No pregnancy for 2 weeks. Kò sí pregnancy for 2 weeks. You can only start pregnancy from 4 weeks. Kápẹ́ kó yẹ kí n ṣe period lónìí, n ṣe period ní fọkàn mi balẹ̀ wípé okay, ìmọ̀ ṣe period then bóyá ọ̀túnla mo lè lọ ṣe pregnancy test. Ó lè mọ́ positive the human gonadotrophic hormone ó lè má ṣe. So màá fi kalẹ̀ wọ́n ní kí n fi kalẹ̀ till 5 weeks. So you're positive. Tó bá ti positive then 6 weeks. Ní tún padà ṣe mí tí mo bá lọ ṣe scan nígbà yẹn wọ́n rí heartbeat, wọ́n rí sac ọmọ. Kò sí pregnancy for 2 weeks. Ẹnìkan béèrè ó ní kí n sọ nípa biopsy. What do I want to say about biopsy? I don't work in the lab. What do you want me to say about biopsy? Biopsy, the only thing I can say as a midwife is when they take anything from you, they will put formalin tí ò ní jẹ́ kí kíní yẹn kó wà decay. Then they transfer it to the lab. The lab will do it. I don't know the way they do it. There's nothing to say about biopsy. But the biopsy is the one that is going to show any cancerous cell. That is all I know. That is all I know about it. I can't say what they had, what they are looking for. I won't know. I won't be able to know. But I know that when you do biopsy, then you show wípé nǹkan báyìí wà ńbẹ̀. Yeah, pregnancy woman can take folic acid till you give birth. We usually take it during our own time. When you are pregnant, you take folic acid from day 1 till even 6 weeks, till 6 weeks. Because iṣẹ́ tí folic acid ń ṣe ni pé ó ń jẹ́ kí wọ́n bí new cell. So the side effect for implant is either you are bleeding or your period didn't come. I don't talk about medication. If you go to the hospital and they tell you you have low progesterone, then they will treat you. I don't treat. I don't treat. And that is the reason why I don't order for any test. So many things can cause fatty liver. Fatty liver is when, as they call it, fatty liver is when there is fat in your liver. Tí wọ́n rí ká gbà pé liver ni, tí wọ́n wá rí wípé fat yẹn ó dúró síbẹ̀ báyìí. So many things can cause it. So many things can cause fatty liver. Liver problem can cause fatty liver. The food we are eating can cause fatty liver. When there is a high cholesterol, it can cause fatty liver. So if you have fatty liver, listen to your doctor, your hepatologist. Okay, I did colonoscopy, remove tissue from me while I'm expecting them to call me, but not. Okay, I got you right now. So you're panicking. No news is good news in the hospital. So at least tell your boss say any biopsy. If there's anything growing there, they will call you quick. But at least ó máa ń tó 2 months kí wọ́n tó péyàn. Kí result yẹn kó tó ṣe ó máa ń tó 2 months. So don't expect anything before 2 months. But if they call you quick, it means something is happening there. But if they didn't call you, it means the result is probably okay. But kó tó lè di pé èèyàn gbọ́ anything, it's going to be after 2 months. So mo máa ń dáyàn ní 6 weeks to 2 months. Before 2 months, you won't hear anything. But they will call you after 2 months. Because when the result is out, they will sit down to debate on it. Except if nothing is growing, if nothing to panic about, then they will call, so no news is good news. Lọ́pọ̀ ìgbà lọ́sítù. If you do any test and they're not rushing to call you, it means things is not going the other way around. Okay, mine is 3 months. Then you don't need to panic. At times, no news is good news in the hospital. No news is good news. Tí mo bá ti sáré mọ̀ pé èèyàn, a jẹ́ pé nothing to worry about. Olómi. Thank you, everybody. I need to go. It's nearly 5 o'clock. I've been here for three hours, three and a half hours. And that is okay with me. To repeat myself, can someone still have children at the age of 44, 45? Yes, you can have. If you're ovulating, if you're bleeding, if you're menstruating, and you have egg, you can have. You can have. Thank you, everybody. So, cancer ò kí ń ṣe nǹkan tá a máa dẹ́rù bara wa. Wọ́n ní tá a bá jẹ ẹ̀pà, èèyàn ní cancer. Wọ́n ní tá a bá jẹ búrẹ́dì, èèyàn ní cancer. Wọ́n ní tá a bá jẹ eléyìí, èèyàn ní cancer. Yes, you can DM me. No, it's not like that. Mommy with question today, na 5 and 6. Say, Mama said, and people are dramatizing on my page. I only wrote it there that religion is supposed to guide us, not to colonize us. The religion is one baradale níbẹ̀. Is that a bad statement? And the council, a stupid old man was telling me, say àwọn CIA, àwọn ni wọ́n rán mi. Ẹ wo bí tọ́pọ̀lọ wá tó ṣe sí. I'm going back to his DM to tell him I'm not an agent of anybody. I'm a woman of myself. I'm not an agent. I don't collect money to speak. I don't. Àwọn religionists náà máa lọ ń gba owó lọ́dọ̀ àwọn èèyàn to speak. I don't collect money to speak. I don't collect money to speak. Why will I collect money to speak? I'm not picking anybody up. If you have questions, ask there. I'm ready to go. I'm not picking people up again. I'm not picking people up. I'm ready to go. If you have question, ask for you can. Then I will answer it. Just write it there for me. Yeah, you can tell me. No, I'm not talking about varicocele today. So people will bring their diagnosis. Varicocele is just the dilatation of the blood vessels, maybe testicle. That is all what varicocele is. You see that they do the operation or they treat it. Is there any side effect for Mounjaro? I don't talk about medication. I don't know the people that do this Mounjaro, so I don't know anything about it. Mineral is good for them, but don't give too much. Like my grandkids, they love it. And that is the reason why they like running to me. They like fizzy drink, but don't give too much. So many things can cause pain during sex. Sex is meant to be painful, but not to be very painful. There is usually pressure. When there is no tí ò bá sí eré tó pọ̀ ní ẹ̀rín ọkọ àtìyàwó, you feel it. So I think nearly every woman will feel pain during sex. I usually come out like around 1 o'clock, but someone is inviting me to her page tomorrow, in which I will be there for just like 1 hour. She want me to come and explain my talk that I did after the death of Ogogo about combining medication together. So I will go to her page first in the morning, then before Jumat. Before Jumat. Can abnormal cell on cervix treatable? Yes, it is treatable. Colposcopy. And at times your body will get rid of it on its own. But if your body is not getting rid of it, colposcopy can be done. It will burn it. Yes. Yes. Very well. The only risk is when you didn't get it until it changed the DNA of the cervical cell. It can be treated. Thank you, everybody. Thank you, Facebook. People on Facebook. Oh, up to even the last minute, I still have up to 6 people on Facebook. I still have 3 on YouTube. Thank you, everybody. I really appreciate you. So please, if I post anything religion and you don't like it, just forward pass yourself and just leave it. I just want us to see, just to know that we are not practicing religion the way it's supposed to be done. It is your private life. It's your private life. People don't need to get angry with you. Even though if you stay on the internet insulting God, it's not anybody's problem. It is you that God is going to strike. But what I see is the moment you start talking about religion, people that are eating, if you like, tell me that paracetamol don't work, I will never come out to attack you. I will only come out to talk more about it. That, okay, when you take paracetamol is being made from this, blah, blah, blah. This is the side effect. Okay, if you say, I don't believe HPV cannot cause CA of the throat, I'm not going to be there to be arguing with you. I don't need to argue with you. Mine is to say it. So I don't know the reason why you say anything about religion, then people will be dying on your page. Why is it our surname? Why? Because they want to colonize people. They want to colonize people's head. They only want to be talking about hadith and what the Quran said about 400 years ago. That you cannot use it to do electricity. You cannot use it to pay bill. You cannot use it to do research. Thank you, everybody. See you tomorrow. I will come at like around after Jumat Lola, but I'm going to one page. Chika at around Laro Lola. I want my auntie to jáde, so I will go to her page. She said she will ring me this evening to let me know. She has been requesting, and I don't want to disappoint her. Thank you, everybody. Thank you for your gift. Thank you for power tapping. Thank you for listening to me. Thank you for your question. Thank you for believing in me. Take adequate care of yourself. Anybody can have cancer, and it's not easy to diagnose. And stop scaring yourself. If you eat this, if you eat that, if you eat this, if you eat that, eat minimal, moderately. Sleep. Don't stress yourself too much. See you tomorrow. We're not going to talk about health tomorrow. We're going to talk about something else. Then another time, we are now going to talk about high blood pressure again. It's quite ages. We talk. The reason why I usually come back to talk about all these things is nítorí tí mo máa rí àwọn tí wọ́n ń ṣe egbògi wọ́n sọ pé kíní tẹ́ ń wò lọ́wọ́ mi yìí oògùn hypertension is a lie. It's a lie. It's going to cure the hypertension. You don't cure hypertension, you manage it. You don't cure hypertension, you manage it. Thank you, everybody. See you when? Tomorrow. Bye-bye. Thank you. Thank you, my people on Facebook. Thank you very much. I really appreciate you. See you tomorrow, inshallah. My people on YouTube, thank you. I'm really happy with my YouTube nowadays. Even though they haven't done much for me, but people are watching me live now, which really make me happy. Thank you. See you tomorrow, inshallah. Thank you.